we want to wish everybody a really huge thank you as we get things kicked off, not just for your patience as we get things started, but also for your presence here tonight, for taking the time to be with us. So we're going to call the meeting to order. It's a special meeting of the Board of Commissioners, and what that allows us to do is to accept public comment on the record. And so at the culmination of the meeting, as we work through the presentations, at the end, we're going to give every single one of you 5 minutes to speak if you'd like it. And we're committed to staying here for as long as we need to hear all your voices. There also is an option, if you'd prefer to get in touch with us and reach out to us offline. There are green contact forms that are outside, and what we can do is, as we get closer to the public comment time, we can make sure that we give any out if you have multiple questions. But the key thing about those is we really want to make sure that we're getting your information, your name, your email, phone, whatever you're comfortable giving, so that we can really have a strong line of communications between us and you. We want to answer your questions, your concerns, your clarifications about our mental health system here in Center County. So as we begin all of our meetings, we would ask you to please rise if you're able for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So we want to just recognize the fact that we are being recorded tonight by CNET, and we thank them for the ability to be here tonight. This is being live streamed as well on YouTube, and we actually have, at last count, about 25 individuals, our fellow community members, who are actually down in courtroom number 3 just because of the size of the event. So they're watching us down there as well, and we're going to do our best as we get to the public comment period to give them the opportunity to speak as well. So we may have some folks that are downstairs right now coming up to ask questions. So we may have a bit of a line in the back, but that's okay. We'll work through it. So on behalf of the Board of Commissioners, again, thank you. We want to use this opportunity tonight to provide information about our mental health services here in Center County. We're honored to have 2 individuals from the state, Kelly Wada and Scott Liddick, to talk about the services the Commonwealth offers and the way that those regulations and mandates flow down to the counties, and the partnership that we have between our state folks and also our federal mental health folks as well. We're also going to have a presentation from our mental health administrator, Natalie Corman, who also serves as our human services administrator, and Natalie's going to be able to walk through the various services that we provide here in Center County. And this essentially is going to be a good framework that we can give you as much information, sort of like a TED Talk on mental health services, that we can provide to you so that when you have questions and feedback for us, it helps to inform that. And again, if there are questions or clarifications about the programs and the services we provide, again, we're going to give that 5 minutes to each and every one of you to ask your questions. So we are going to turn it over at this point, as I mentioned, to Ms. Wada and Mr. Liddick, who are going to be able to, again, provide that overview of the Department of Human Services and also the Office of Mental Health and Substance Abuse Services. And that is, again, going to provide us a great framework. So at this time, we'll hand it over to Kelly and Scott. Thank you again for being here, both of you.
Bear with me. Does this work? Which one works?
Silver one.
Silver one? Does it? It's on. Can you hear me? Can you hear me okay? Okay, I don't. That's fine. Is this the clicker? Okay. That's fine. It just didn't seem, I'm used to echoing.
Okay.
I'm sorry. So. Okay, I know how to work it now. Technology is not my strong point. Again, my name is Kelly Wada, and I work for the Office of Mental Health and Substance Abuse Services. I'm the Director of Western Operations, and Scott Liddick is the Community Program Manager in the Harrisburg Field Office, which you'll learn just a little bit more. The presentation tonight is a very general, high-level overview of the Office of Mental Health and Substance Abuse Services. It by far is, I think we do a lot more than what is just in the slides, but we could have an hour presentation on a little bit of everything that we do. So again, this is just a very high-level overview, just to kind of get a general idea of the Office of Mental Health and Substance Abuse Services.
I just want to check in with our audience and see that. Do you need to make any adjustments? Do you want to make sure?
Sounds great.
We're great? Okay.
Okay, good.
Now, you said a look at your face.
Yeah, do something if it's not working, so I'll pay attention, because I'm going to be going back and forth here. Okay, so Office of Mental Health and Substance Abuse Services is an office in the Department of Human Services. So other departments that might sound familiar to you are the Department of Drug and Alcohol Programs, Department of Health, Department of Inspector General. So there's various departments in the government. Under Department of Human Services, again, we are an Office of Mental Health and Substance Abuse Services. The other offices are Office of Children and Youth Services, Office of Medical Assistance Programs, Office of Long-Term Living. So we're one of many offices within the Department of Human Services. OMHSAS, which is what we call ourselves instead of Office of Mental Health and Substance Abuse Services all the time, consists of the Office of the Deputy Secretary. That's Val Vicari. She wanted to be here tonight, but unfortunately wasn't able to make it. We also have the Office of the Medical Director. Dr. Mike Usman is our Medical Director. And then we also have 5 bureaus. And the bureaus are the Bureau of Children's Behavioral Health Services, the Bureau of Community and Hospital Operations, which is the bureau that we work in, Bureau of Financial Management and Administration, basically the money people. The Bureau of Policy, Planning, and Program Development. This is the bureau where all of the policy clarifications, regulations, they all start. And then the Bureau of Quality Management and Data Review, which is basically what it sounds, quality management. All of our data systems is in this bureau. You can read the guiding principles of the Office of Mental Health and Substance Abuse Services, but briefly I kind of want to go over what our mission statement is. And the OMHSAS mission statement is every individual served by the Mental Health and Substance Abuse Service System will have the opportunity for growth, recovery, and inclusion in their community, have access to culturally competent services and supports of their choice, and enjoy a quality of life that includes family members and friends. And again, these are the guiding principles under that mission statement. The overall responsibilities of OMHSAS, and again, these are overarching, are to develop, monitor, and evaluate services in partnership with the counties that we work with, consumers, families, and advocates, and other stakeholders. And this is done in various ways. We have advisory committees, we have our planning council, even the brochures, the CSPs, community support planning. We have in the children's world, CASP, Children and Adolescent Services Support Program, I believe. I'm so used to acronyms, I might not know what they stand for. But these are, and we again jointly work with our counties to develop services. We also represent true collaboration with other agencies and offices in the service system. We are looking at treating the whole person. I mentioned some of the other offices, Office of Medical Assistance Programs, Office of Long-Term Living. They operate some of the physical health choices programs, which we'll talk a little bit more, health choices in general later. But there's a lot of collaboration and a lot of initiatives that go on, not only with the other departments like drug and alcohol, but also our sister agencies. Ensure a responsive behavioral health system that is developed, maintained, and reviewed on an ongoing basis. We review county plans, we review, which Scott's going to allude to a little bit more, licensing. So any type of program that we license, we review those on an annual basis. Anytime complaints come in, we also monitor the behavioral health managed care organizations. So we do a lot of collaboration, and then the system to make sure it's maintained and reviewed on an ongoing basis. And also, we are a conduit between the community and then the state in general. Again, the Bureau of Community and Hospital Operations, which is where Scott and I work. is divided. There's 4 regional field offices. We have the Western Operations, which I'm the director of, and then there's the Eastern Operations. And this is just more of a list of, we have a Scranton field office in the Northeast. The Southeast, our field office is in Norristown. They serve these counties. And then Western Operations, it's Harrisburg, which is the central region, and that's for Central County, falls under the central field office. And then Western is in Pittsburgh, and these are the counties that fall under the Pittsburgh field office or Western Region field office. And the next slide's just more of a visual, kind of get a better idea. And again, so the kind of green and light green, I guess you would say, is the division of Western Operations. Field office responsibilities, sorry, too fast. Again, Scott's going to talk a little bit more about the licensing and approval of the programs that are licensed through the Office of Mental Health and Substance Abuse Services. Again, we have program oversight. Natalie might talk a little bit more, but we have county program oversight. Again, all of the block grant county planning process, we coordinate, provide feedback as part of a bigger system within the department on the plans. Also, through licensing, there's the county program oversight, the Behavioral Health Choices Behavioral Health Program, Behavior Health Choices, or Health Choices Program in general. For those that don't know, it is the managed care mandated Medicaid plan in Pennsylvania. So behavioral health is carved out, so there is separate behavioral health Choices Program and separate from physical health. And so physical health is managed under the Office of Medical Assistance Programs. In the very near future, January of this next year, will be community health choices in this region. And so all the individuals that are dually eligible, which means Medicare, Medicaid, their physical health will be covered under community health choices instead of fee-for-service. They will still have behavioral health choices through the behavioral health choices contracts. And then initiatives, special populations, we are involved, again, just within OMHSAS and then with the bigger community sister agencies as well. Examples are Veterans Affairs. We're very involved, sit on many work groups within the Veterans Affairs, forensic issues, specialized services, individuals with dual diagnosis of mental health, intellectual disability, transient, youth, a little bit of everything. We're involved across the whole systems. Special populations I just mentioned. Anytime there's pilot programs, we're involved with. More of the recent one that with policy that we all sit in and also contribute and work with our pilot programs was for peer support. And Scott's going to talk about the licensing.
Evening, everybody. I'm just going to real briefly, again, a high-level overview of what we do as far as licensing goes in the field office. So Articles 9 and 10 of the Public Welfare Code and Title 55, Chapter 20 are the regulations that give the department the authority to license providers in the Commonwealth. The major requirement there is that we must have an annual inspection. So every 12 months, we will have an announced visit of each licensed site. Now, if in addition to the annual inspections, if there is any reason for us to go on an unannounced visit, we may do that at any time. So if there's any kind of sentinel event, this could be a death, a suicide attempt, allegations of abuse, we are able to go unannounced. This would also be if, say, we got complaints from the community, if there's anything that comes to our attention that becomes a health and safety issue that we want to take a look at. We have the ability to do that. We would also be able to cite providers against the regulations. We would require corrective action plans. We could issue a provisional license, or we could even go as far as non-renewing a license or revoking a license if the allegations and the issues are egregious enough. So again, OMHSAS, specifically the field office, is the office that will license the mental health programs. All of our regulations can be found under www.pacode.com. So if you get on there and browse under Title 55 is Human Services, and then all of the mental health regulations are in the 5,000s. You can also, there's also the bulletin search website, and I understand this PowerPoint's shared, so you can locate this later. Some of our programs are licensed on our bulletin, not all have promulgated regulations, so you could find the bulletins on the bulletin search site as well. And then there's also a link to the Human Services Provider Directory. This would have every licensed site in the Commonwealth would be on this. So if you wanted to look at the status of a provider's license, it would have a copy of their license there and every licensing action that has been taken against that provider. So, looks like my title's taken off here, but this is so this is a list of all of the services that are either licensed or approved by our office. So these are all of the state plan services in addition to a number of others. From outpatient and partial down to even sort of our evidence-based practices like multi-systemic therapy and functional family therapy. So these are all of the services that we will visit at least on an annual basis. As far as technical assistance goes, whenever a provider needs any assistance whatsoever, it could be a new program, it could be a provider that's expanding services, it could be a provider that is having issues developing an appropriate plan of correction. We would certainly provide technical assistance to be able to assist that provider to come into compliance. And our goal in licensing is not a an I gotcha kind of thing. We really want to promote quality in our programs. We want our programs to get better. So we're always available to provide technical assistance when necessary. And additionally, through licensing, we do work very closely with the county mental health office. We invite the counties to licensing reviews. We request their support whenever there's a new program or an expansion, or if they're requesting a waiver of services. We always make sure that the county is aware and in support. So that's brief licensing 101 there. I'll pass it back to Kelly.
Excuse me, it's a little bit taller than me. Okay, as far as the service delivery system, again, this is very basic, general overview, but the Mental Health Intellectual Disability Act of 1966 established some bare minimums that the county-based service system has to address. And I know Natalie Corman is going to address these in a lot more detail, but I'm just going to briefly, as far as for mental health services, what the Act requires are that counties provide short-term mental health inpatient, partial hospitalization, outpatient, and emergency 24-hour services. And again, Natalie's going to get a lot more in detail into the services and how it relates to Centre County. And also in the MHID Act, various activities related to the mental health procedures and the county responsibilities are outlined in that one as well. We also, OMHSAS allocates all the funds to the county governments for the provision of community behavioral health services. This goes to not only the county services, but there are also, for the HealthChoices programs, we allocate the MA funding for that as well. There's some drug and alcohol funds that also come from the department that are allocated through OMHSAS. And the state hospital system, as it says, through OMHSAS, we also, community hospital operations, we operate 6 state hospitals, as well as South Mountain, which is a nursing facility in the state of Pennsylvania. It's its only state nursing facility. all the dollars that we allocate this next year is projected a little over $6 billion. And out of that, the Health Choices Program is $4 billion of that. And again, the Health Choices Program is the mandated managed care health choices for behavioral health. And our budget for that is about $4 billion. And as you can see, as of April of this year, there are 2,630,000, a little over, participants that are enrolled in behavioral health choices. It began in 1997, and it was for behavioral health. It was implemented statewide by 2007. Physical health took a little longer to catch up with us, but we've had health choices throughout the state since 2007. Centre County was in that last 2007 July rollout, if you will. And in Centre County, the behavioral health managed care organization is Community Care Behavioral Health. And I think Natalie's going to give a little bit more information about that too. Again, OMHSAS works closely with the 48 single county or multi-county program offices. I know Scott and Natalie and all the other different MHID or human services, we have very frequent, Scott more than me, but very frequent contact with everybody. And again, this is just what the county's role. There's 67 counties, 48 MHID program offices because there are joinders. Services are operated either directly by the county because, again, they are required for those certain services, the outpatient, the partial, or they are managed by contracted providers through the county. In addition to the services, and I know Natalie's going to get a lot more into these as well, the county provides a wide variety of other traditional services as well as other evidence-based and promising services. Counties also, that's one of the reasons we work so closely with them. There's also a lot of natural supports in counties, and counties know those natural supports. They know where to send somebody that might need food. They know where to send somebody that might need some transportation issues that may not have covered under medical assistance transportation, or they can't get there. So the counties are also very much aware of what's going on as far as the natural supports, what we refer to as natural supports, and not a mandated or a service that's naturally allocated through state funding. State plan services. These are going back to more the Medicaid line, if you will. State plan is our contract basically with the center, CMS, Centers of Medicare and Medicaid Services, that we say in our state plan, these are the services that we are going to provide as a state. So these services have to be offered for anybody that qualifies, because a lot of these services have medical necessity criteria, if you will. But these are the services in the state plan for behavioral health that are required for us and as a state to provide to everybody. So in the Health Choices contract, these are services that they have to provide at a minimum. So again, that includes inpatient psychiatric hospitalization, inpatient drug and alcohol detox and rehabilitation, psychiatric partial hospitalization, which is often referred to as just partial hospitalization. They have to have, again, access to these services. Certain lab and diagnostic studies as it relates to behavioral health, and most of that's going to relate to the clozapine, clozaril support. Outpatient psychiatric services or outpatient clinic, drug and alcohol outpatient, methadone maintenance, certified peer support services, crisis intervention, and then mental health targeted case management, which is often referred to as intensive case manager, blended case manager, resource coordinator. So that's referred to as, those are targeted case management. This is just a map, and it's very hard to see, but you might be able to see it if you have access, of the our different zones of how health choices, behavioral health choices rolled out. And each county, and then the Behavioral Health Managed Care organization that is in each of those counties. And the numbers just represent the number of individuals as of April that were eligible for medical assistance. So that the covered lives, if you will, those are the numbers if you can read them. So Centre County, where are you? I can't read you. Oh, a little over 12,000 it looks like, if I can read the numbers, were MA eligible individuals as of April of this year. Okay, and then this is just another a visual There's 5 behavioral health managed care organizations in Pennsylvania. We have Community Behavioral Health, that's in Philadelphia, and it's only Philadelphia, and it's Philadelphia County actually established their own community behavioral health organization. Community Care Behavioral Health Organization, CCBH, CCBHO, you might hear it. Again, these are the counties. There's 39, I believe, and Centre County is one of them that's covered under Community Care Behavioral Health. Magellan Behavioral Health is in Bucks, Cambria, Delaware, Montgomery, Lehigh, and Northampton counties. Perform Care in 9 counties. And then Beacon Health Options, they were formerly Value, are in the Southwest, and those are the counties that they're covered. And under Perform Care, Bedford Somerset, as of Monday, is actually going to be a community care behavioral health. So there'll be 2 added to 41 for community care behavioral health. Mm-hmm.
Kelly and Scott, thank you so much for the great overview of what the state provides and the structure for it. As Scott mentioned, on our website, centercountypa.gov, we're going to post this presentation at the conclusion of the meeting, so you're going to be able to have the PowerPoint for your own information. And we're now going to focus our energy into Centre County. And before Natalie takes the mic, we just wanted to introduce her as, again, our mental health administrator and also our human services administrator. And Natalie has this fantastic perch that she's able to view the different human services we have here in Centre County and divert services, make changes, make recommendations about how we can improve things, do things differently. And she carries with her over 2 decades of service to the citizens of Centre County. So we are excited to hear from her at this point. So Natalie, the floor is yours.
Thank you. Good evening. So as you heard from Scott and Kelly, you know, the state is an important role with us. That's really our job at the county, is to know what that role is. We know what the 5,500 regs, we know what the acronyms all mean. We have to know how many people in our community have the ability to access medical assistance for help, but then we have to know about every other individual that wants to come through our doorsteps who are in need of assistance and who are in need of services. Beyond that, we also have the obligation to do the services that the state plan has told us that we have to do. But then we've also listened to our community, we've listened to individuals over the years, and we've developed services and enhanced services, a lot of that feedback. So tonight, I think what's really important as you walk out the door tonight, please make sure you walk out the door tonight with a purple book, as you probably both have. Take one, take many, take them all. We got 500 of them printed just for tonight. They are our most recent books. This is your doorway into knowing what it is in this community that we can offer. It is a glimpse into it. It's a big glimpse into it, but it really is that opportunity for you to walk away tonight knowing that you can make a phone call, access services, give that book to somebody else who might be in need of it. And so for those of you tonight, as much as we go over this PowerPoint and I talk to you about services, I cannot stress enough the importance of walking out of here tonight with a purple book and knowing what you can call us about tomorrow or the weekend or anytime in the near future. So the services I talk about tonight on this PowerPoint are going to be in those books, so it's just really important that we talk about that. So with that said, we've talked about the Act. That Act charged the county with an obligation to offer services in our community. So we understand that, we know it. That's what this Act did for us. So the services that I'm going to talk about tonight are primarily the services that we as a county contract with providers in this community. So every Tuesday, almost every Tuesday, I'm in front of these Board of Commissioners asking them to sign contracts committing us to do a service in this community. So while some of the services I talk about tonight, like outpatient, there's going to be providers in this community that don't contract with the county, and that's great because we need them for those of you that have private health care insurance. We need them for additional individuals in our community, but I'm really just going to talk about those that we contract with tonight, just so you kind of get an understanding of our role in the overall mental health community in Centre County. So there we go. So the first thing we want to talk about is hospitalization. Sometimes that is a way that an individual comes into our need of services, is sometimes through a hospitalization. So as much as we use acronyms, we also like to use numbers in our world. So something that we call a 201, based on the Act, is a voluntary hospitalization. So that is an individual who is seeking the need to get care in a hospital facility, who are going on their own. They want that, they know they need it, they recognize it, they're seeking it. We have facilities here. We have Mount Nittany Medical Center, who has beds on their unit and their facility as well, and we have Meadows Psychiatric Center, which is located in Center Hall. Both of those places have individuals who have the ability to go in voluntarily. If it's beyond that, if they're at our ER and there's not able beds, we help with that. There's support from other community agencies that help link to people. A lot of times it's healthcare providers who also help link people to where there's an available location for them to go. So an involuntary commitment, so the 302, so 201, 302 is our numbers. So that is when an application is presented to us by an individual, in whatever capacity it is, who is presenting the need for hospitalization due to a significant danger to themselves or to others. There's also the understanding that there's an imminent plan, there's an imminent danger. There's a lot of parts of this that we do. And so a involuntary commitment is that. It's for up to 120 hours, 5 days of psychiatric treatment if a 302 is approved. So under the Procedures Act, it outlines the obligations that we have as a county to do that, which we call a delegate. And it also outlines the obligation of our physicians, which in this community is primarily our emergency room department physicians. That is who evaluates for the need for hospitalization in this community, are our ER doctors and physicians. So we contract with Can Help, who does the delegate responsibilities for that. So they issue the warrant. If an individual is going to go into hospitalization, we make sure they secure their belongings. If they have pets, if they have animals, if they have home, if they have children, all of those things are part of what we secure to make sure that while they are there for the time being that they need the treatment on, they can focus in on that, and knowing that the rest of the situation that they have at home has been assisted by us. And we also do the bed search for us to find a home. So beyond just hospitalization, there are people that are in crisis. They might be experiencing symptoms for the first time. They might be just struggling for whatever variety of reasons. We need to have emergency services. So 365 days, 24 hours, 7 days a week, we operate what we call Can Help. That individuals can call, they can do a walk-in, which they are located at the Meadows, and they also have a mobile response to that. A lot of it is about linking people to services, linking them to natural supports, as Kelly talked about up here as well. It's linking them to what they need in that moment of crisis, and we provide that through that emergency service. So, oftentimes after an emergency service or hospitalization or just the first time they want, they're seeking services. And that is a role of ours as we have as a county to help people figure out where to go and how to get help. So we do what we call intake services. So our office is located at Summit Park. For those of you that have lived in Center County, maybe for a long time, we're the old Corning building. So our offices are actually located there. They're not located in our typical Willowbank building. We are actually out there at Summit Park. So it's easy of access. We have transportation. We're located there. But individuals that we see, we have criteria based on state about your income, your insurance, diagnostic needs. But we assist people every day who call into our office saying, I'm looking to do this, I'm looking for help, what can we do? We answer family member calls, we answer. Our services are voluntary. That 302 I talked about is the involuntary part of our world. But the services that I talk about kind of moving forward, except for one part, is about voluntary. So we need to speak to the individuals who are wanting the services, needing the services. We engage with family, we engage with all different kinds of groups to talk about it, but come this intake part that really is us connecting with that individual to know what their next steps and what they're seeking is. So with that, that's because we have what we call case management. So we do blended case management, as Kelly called it, is targeted. We also do administrative case management. We currently serve 888 individuals in Center County with this case management service. This service can be because you have medical assistance and we can bill for that, or you have normal Geisinger insurance. We don't bill Geisinger. The county funds that. It's for people who have no insurance at all. The county can fund that. That is the funding that we receive for that. Strawberry Fields also, who we contract with, offers blended case management as well. It's a really important service. We go out in the community, we meet with people every day, we engage with them, we support them, we are part of their recovery and what they are needing. So we do this day in and day out. We are on call for blended case management. We do all of that. Administrative case management is typically people who might just need the assistance to a psychiatrist. They might need assistance to go to therapy, but they're not needing maybe the additional one-on-one time with case managers. So we have administrative case managers. At a minimum, we meet with them yearly, but that's because they're engaged in other community services in this county and have that support that they need. So we have different levels of case management for those needs. And individuals choose how often they see our blended case managers. I will say that, we see them anywhere from weekly to every 4 weeks, but the individuals let us know how often they'd like to engage. So outpatient. So I'm starting to tell you the number of people that we serve. Last fiscal year, because that's how we live, we served 93 people who needed to be seen for outpatient services. So that's medical management, that's therapy, that is all the different ways that we engage with people. So there's our list of providers that we serve, that we contract with. And again, the Purple Book lists way more than that. But that's who we currently work with. That's who individuals, when they come into us and we have to fund their, due to their financial needs, and we understand that, that's why we exist. That's who we work with to make that services available to them. So psychiatric rehabilitation. So as the state talked about, they talked about partial hospitalization. So we offer partial for children, but adults have really, over time, talked to us about psych rehab. We call it psych rehab, we abbreviate things. It's really about whole person. It's about recognizing all parts of an individual's lives and what they need to be supported of that. It's employment, it's education, it's socialization. It's all the different ways that we really want to support an individual, and psych rehab does that for us. It is a men's service for us. For those of you that have come to our candlelight visuals over the years, which we really cannot say enough about, they are held every May. We've 14 years, I think we've been holding those candlelight visuals, and our clubhouse, which is the psych rehab program, holds that for us. And it is an amazing event that we hold every year, and you really get to see the people who are often engaged in our programs at those events. So we also are charged to do employment and vocational. Again, it's about a whole person. It's about all the different opportunities that we need to present and offer so people know their options. So we talk about skills, we have mobile, we talk about just employment opportunities for that. So we offer those services. Consultation and education. We use Penn State Psychological Clinic to often help us do some education. So as much as I stand up there and talk about our world, we understand that education and training needs to happen in other worlds. So Penn State, for example, goes into our correctional facility and offers a lot of consultation education to our staff at our correctional facility, as well as individuals who might be at our correctional facility at this time who could really use some assistance for mental health. So Penn State is one of those people that we get to work with for that. So Danville, so Kelly mentioned this. So hospitalizations, beyond just our hospitals for psychiatric stay, is Danville State Hospital. So we have 7 beds that are allocated for all of Center County to assist people in their most need time for long-term hospitalization due to their illness, is Danville State Hospital. We share that with 16 other counties who have to have a total of 161 beds for that opportunity. So over the years, there has been funding given to the counties to try to enhance community supports to assist those who are leaving Danville or might not be going into Danville, and we have other opportunities. But it's important to note that long-term hospitalizations, such as that, really fall in the hands of us working with Danville State Hospital. And just as a note, for individuals that go to Danville that come from here, we are engaged. We go down there, we meet with individuals, we talk with family members, we talk about what their next steps are when they leave Danville. It's not that Danville is, an hour, 45 minutes away from us. We are absolutely working with that individual while they are there for their opportunity for what they need for when they come home to this county here, if they choose to come back to Center County. So aftercare is that. It's exactly what I talked about, is how we work with individuals to do that. We've also expanded our services, and I'm going to touch on some of those. We really took that notice that, it's only so many beds that we have, and really that need is so critical that we've really expanded our services to what we call diversion, where we find services in our community that can really wrap around an individual at their greatest needs to keep them in this community, to keep that family engaged, to be a part of it. So we do a lot to further that living environment. And that's what a lot of our residential programs are. Community services groups, Strawberry Fields, Eagle View, Eagle Valley, they really help us with housing opportunities and supportive housing opportunities located throughout this county to really help people live and grow and recover in this community. So peer support. So peer support is required in our plan. It's really important to note that certified peer specialists can be an instrumental part of an individual's recovery. These are individuals who have self-identified as having previously been in a mental health system of services or are currently in services, but have gone through the training to be a certified peer specialist. They then are matched with an individual in this community, and they work with them together. They create their own goals. They create their own support system. They walk in this community together, recognizing that they come from that understanding that a peer can. And so certified peer specialists are an important role that we have. St. Clair and Strawberry Fields offers that to us. So I'm going to talk a little bit about money, because I know that money always is something that's talked about when it comes to mental health services and the need for money and what it looks like. So these are calendar years, 2017, 2018, 2019. So you can tell from federal, 150,000 under that. The counties have been about 180 to 166,000. So $3.7 to $4 million comes from the agency that stood up here and talked to you 10 minutes before me. That is why it's so critical that we work with them the way that we do, because so much of our funding comes from them and the regulations and the policies that we follow for that. We really are obligated to match a certain percentage of our funding, and that's what the county has consistently always has done, has met that match, if not has been needed more, to do those services in our community. So it'll look better, but if you notice the red, those are services that we have to do. So there's 6 or so, 4 or 5, that we additionally provide in this community. So that shows you how we spent that $4 million throughout our community. Residential, as you can tell, is probably one of our highest services, because it is 24-hour assistance for individuals. Housing support, again, for that. So you can see those 2 line items alone are a critical part of our funding that we do. So they touched a lot on community care, and we touch along community care because, as I told earlier, so we serve 888 individuals in case management. A portion of them, a good percentage of them, have medical assistance, but some do not. Community care is that partner that helps us, for individuals that have medical assistance, fund those services. So we really have to work directly with them because they are that payer of some of these services. So they gave us a number, a chart, which again is small, but I think what's important to note is while we spent $4 million entirely for all of the services that we do, they have spent well over 6.25. It's only $4 million because it's only through part of 2019. So don't think they dropped off. It's just the timing of this. But it's important to know, we might have spent, I'm going to go back. In outpatient, in 2019, we're expected to spend about $106,000 for outpatient. They're spending $1.667 million in outpatient services because we are meeting people who have that need in our community through medical assistance to do it. We then can assist those that do not have medical assistance or do not have insurance. We can then fund that. So CPS is Certified Peer Specialist and TCM is Targeted Case Management. We never like to not tell you what our acronyms mean. They're correct. We have a little over 12,000 individuals in this community that are covered under medical assistance. The remaining individuals that live in this community could have private insurance or obviously, as I said, come through us. And I want to do one more note, and I did not do this in here. So the Act requires services. The Act also requires us to have an advisory board. So MHID has an advisory board. Michael has spoke of that at our commissioner meetings as well. And I just think it's important to note because the Act does charge us with having an advisory board. So we meet every quarter. We have those meetings at Summit Park. Our applications for that are on our county website. We are to have a number of individuals based on whether it's a professional or personal who sit on our board. And I just wanted to note that we have consistently have an advisory board who's engaged and with us and is part of the obligation that we have. Beyond the obligation that we have, we want that opportunity, which is exactly why we're here tonight, to talk about what else can be brought to this community, to talk about services and opportunities that also can be presented. We are always open to learn. As Scott said, I work with counties every day across the Commonwealth. We learn from each other. We have to try to strive for what's best for our community. That's what we always try to remember is what's best for our Center County. So really, this is starting point tonight is to get you to that point. For some of you, you might know our world really well, and some of you, this is your first time really understanding the support that we have in this community. And so with that, I'm going to turn that back over to Michael. So, thank you.
Can you do one more slide? Sorry, if you just click it once more. We have a...
It's online too, don't worry.
Yeah. Thank you so much, Natalie, for that presentation. Before we get into the public comment, we just want to let folks know that we have Natalie Bird-Smith, who is over here to your left, our right, and Natalie's going to, at about 4 minutes into, if you make comments that'll be 4 minutes, she'll hold something up that'll just say a minute remaining. Yep, and that just gives you a cue if you could, make your closing arguments and wrap things up. Again, if you'd like to make comments on the green cards, feel free to do that. We would appreciate that as well, so we can stay engaged with you. I'm going to call people up as hands are raised, and what we're going to try to do is accommodate the folks that, if folks would, that are downstairs, we've heard that we have about 50 folks that are downstairs. If they'd like to ask questions as well, feel free to come up, and we'll do our best to recognize you as well and intersperse the questioners that are up here as well. We want to stress this as well and recognize this and make a point to, because we know a lot of the comments are going to be about this. So we're here tonight due to an event that happened on March 20th. And many of you have had pain, frustration, anger, somebody said to me, just despair and hopelessness in your hearts over the death and tragic death of Osagi. And there are no words to describe that pain. And you're going to hear that tonight, and we want to hear that tonight, because we believe that the only way that we're going to see positive change, the way that we're going to find a bridge into a improved mental health system, a improved relationship in so many ways in our community, is if people are honest. So we want you to be honest. We want you to be, we use acronyms and terms for mental health. Don't worry about getting it right. I mean, just if there are services you want to see, if there are policies, procedures, if there's more communication you want us to see with specific entities here in Center County, please let us know. We want to hear it. But really, we want to thank you again for being here today. Again, we're going to be here until every individual wants to make comments and wants to be heard. And again, we're going to do our best to answer some of those questions tonight, but we may have to respond to you offline as well. But what we're going to do is any question that's asked tonight is going to be documented, and then we're going to post responses to that on our county website so we can all be on the same page. And as well, we're probably going to do something like this again once we can gather information, once we hear about programs you'd like to see, more funding you'd like to see, more initiatives you'd like to see, we're going to be able to continue that conversation. So with that, we will open up the opportunity for some public comment. And again, I'm going to do my best, but we're going to start here and we'll work our way around the room, okay? And if you would mind coming up front, and we would love it if you were comfortable sharing your name and your municipality here in the area, if you're comfortable doing that. And again, Natalie will be able to give you the 5 or the 4 minute. Oh, no, that's okay. Okay, good evening.
Okay, my name's Mina Yendra. I live in Boggs Township in Center County. My son has come into contact with Center County Mental Health in the last few months. I really appreciate the opportunity to be here to express my concerns, get some answers to a couple of short questions. I'm really happy that Center County is trying to approach improvements to their mental health services. My son is a paranoid schizophrenic. He was diagnosed with this at least 15, 16 years ago. When he came into this county, moved here, closer to the mic, please. Okay. All right. When he came into this county and moved here a few months ago, he progressively dissolved, so to speak, and Center County stepped in. Just a minor amount about him, but I want to make the impression that a paranoid schizophrenic is considered one of the most serious mental illnesses that there is. There's zero chance that they're going to recover to have a full normal life, if you will. He was sent on a 302, which I filed to Mount Nittany Hospital. He was 303 there to extend it for another 30 days. Then he was discharged on an involuntary outpatient commitment. I don't know the numbers for that. But at any rate, from the beginning when he went into Mount Nittany, they said that he needed to go to Danville. There just was no question. He is violent. He has started having sexual acting out that he's not able to control in any way, shape, or form. I don't think he even realizes what he's doing. He's unwilling to cooperate with anything that's voluntary. So if you give him that option, that's not going to happen. And he steals things, et cetera. You get the gist of what I'm saying. I mean, he has some serious issues. So when they were talking about Danville, they said there was a 6-month waiting list to get into Danville for a bed from here. But it was critical needs based, so he might be able to boost up in line. Unfortunately, though, because they couldn't get a bed in Danville, he was released to a boarding home that will take people when they have no other way. He does not qualify for any county services, halfway houses, et cetera, because of his behaviors. He cannot be kept in any place like that. So what's happened now is he is in this boarding house. He's continued to get worse. He's more delusional, more paranoid. He is more violent in his appearance. He's even scared the poor case manager that helps him. My question, after all that, is I've heard what the state has to say, and I see there are 6 mental hospitals. I wasn't aware of that. But when you have somebody who, if you release him back into this community, I can guarantee you that somebody is going to get hurt, whether it be him, whether it be someone else. I'm voting someone else. He's a big guy. There could be sexual assault. There could be any number of really horrendous things that happen. Right now, he is loose, so to speak. He's in a boarding house, but he has the means to be able to get around as he wants. I can't seem to get a bed in Danville. The case manager said he needs to be in Danville. Everybody has, and I can't get one. So when the state is saying that we have these and we have these beds in Danville, the critical needs, what do you have to do to get inpatient psychiatric services? Because obviously the county doesn't offer them. But this is a serious issue, just like it was in March. You're getting ready to put a man out there that's going to be dangerous. And I'm frustrated because I don't want anybody to get hurt any more than my son. So, thank you.
Okay. If there's any, we can absolutely talk to you afterwards and make sure that our staff is able to talk to you about it. I don't know if there's anything that we can offer from a county perspective, state perspective on that, Natalie.
No, I would want to make sure we follow up.
Yeah.
But as I said earlier, when I stand up there and I talk about that there's 7 beds, I'm talking about 7 individuals, and I know that. Beds are a term that we use because of the occupancy that we're able to do. We recognize it's about individuals, and it's about trying to find the services for individuals at Danville is that most critical need. And so trying to figure out that opportunity when that crisis occurs in our community is hard. I'd want to kind of have some further understanding just for myself, just to have that conversation. But that's why we talk a lot about those other wraparound services. As you said, the voluntary, involuntary part is the really critically difficult part of it. We do have additional numbers. I just didn't talk about them tonight. You actually were correct. You said 303, 304 is that next number, 305. You know, there are other opportunities that we have. We just didn't get into some of those tonight because it's just, it can get difficult as we kind of go into that. But I would love some additional time to off-do it. And we advocate for when we can for additional opportunities. We will go to the state for additional opportunities if we can. We talk to that, we talk to Danville, we talk to people when we can to try to find that solution when that crisis is right here and right now. We are obligated to be in Danville. I mean, there are 6 hospital beds for all of Pennsylvania. That is the location that we are to be in. Yeah. I know.
We got a place to go, our facility. I don't know anybody right now that I can talk about.
Who can do that? Okay. So I will for sure follow up.
Hi, my name is Cheryl Sharp. I live in Spring Township with my husband, and I have a son who lives in, he's here with us, he lives in State College, and he's on the autism spectrum. He was friends with Asaji. He went to his funeral, which was very upsetting to everybody that knew him. And my son has had problems in the past occasionally. When he lived in Spring Township, the Spring Township and State College police officers, they all knew him. They were very good to him. But now he lives in State College, which is a lot bigger community. And they've been good to him so far, but there are also all those students up there. They may not know everybody to the extent that Spring Township knew him. And my question is, what are we going to do to prevent another tragedy like that? And I worry that it's going to be my son.
Thank you, Mrs. Sharp, for sharing your comments. Thank you. One of the announcements that was made at a recent State College Borough Council meeting was the formation of a task force that was going to be focused on law enforcement, racial equity, and also mental health services in Center County. And so we know we have representatives from the Borough of State College here tonight. And at that council meeting, there was a discussion about, by July, August, having the task force formalized, having membership, having goals, criteria, objectives, so that there are tangible outcomes that can come out of that. From our perspective, that's going to be a great way that we can get everybody in the room, hopefully get not just State College police in the room, but also Pennsylvania State Police, every local law enforcement entity in the county, to start talking about the whole scope of additional things that can happen. But we really want to hear, in terms of training, in terms of policies, in terms of programs, the perspective that you all have of programs that are happening across the country, that are happening around the world, that intersection between law enforcement and mental health, improving it, but also improving it to the community as well. So there's an understanding about what mental health is, the effect that it has on people. That group is going to be the best local solution, we think, to.
We're not charging an officer.
Oh,
We're
sure.
not charging an officer. Why don't tell us who the officer was who did it?
Excuse me, your term is not up.
Sure.
It's disgusting. It's disgusting.
Okay.
Yeah.
Sure.
One of the things I was thinking was, what kind of training will these officers have? Will it be more than just State College? We're talking about the whole Center County. Is there training that the county or whomever is in charge can provide for these officers? I know that I've gone to the National Autism Conferences, and there have been people there that have spoken, either officers or lawyers, that have been able to provide training to people in the community. Thank you.
Thank you.
That's a pathetic answer on your part.
Hello. My name's Evan. I also knew Asazi personally. I think the response is terrible. I just want to start by saying this meeting, there's this very thinly veiled the premise of the meeting is to divert attention to mental health and blame mental health rather than blaming the police who killed him. And the idea is to bring in very nice mental health people who are doing the best they can. They have limited funding. They're trying to do what they can, and say, well, here's this person. Talk to her. Talk to these people, rather than bringing the officer who has yet to be named, who killed him, and they have not released any of the names. They refuse to cooperate, and to bring in these people to be like, well, yeah, sorry, we're doing the best we can. Maybe we'll have a task force. That's preposterous. A task force does nothing if there's not the willingness to do something. There already was a task force, which did, before Osazi was killed, did nothing. I can start my own task force. Let's assemble people, and we'll ask you what to think. It doesn't mean anything, because I'm not in charge of it. They're not gonna, if you don't do anything, if there's no power behind it, it's irrelevant. So there needs to be, as a starting point, how can anyone in this room believe for even a second that there's going to be some sort of change or some sort of accountability unless you tell us who did it and charge that person and tell us who did it? And we've got the cops here. Many of these people may know who did it. The cops at State College know who did it, and they don't tell. If I did that, if I have a friend who killed someone and I don't tell, that's complicity. That's a crime. And it's absurd that these people are allowed to get away with it, and then people bring in these poor people here just to take this abuse and just be like, oh, sorry, we'll do the best we can. We're listening. We're going to listen more. We're going to listen to the next task force. I'm sure they will not. And if anyone here thinks they're going to listen to that task force, I'm sorry, but you're a fool, because they're not going to listen, and they need to demonstrate action. And the idea of maintaining this tone of making this meeting is, people are doing the best, and I'm not insulting it's a boring meeting so far. It's no disrespect. We're working with tough material. I wouldn't be able to lead an entertaining meeting either. But, bring people in, discourage them by making them sit through a long, boring thing, and, listen to people complain. They'll listen to me complain. They don't care what I'm saying right now, obviously. They have no intention to do anything differently, no matter what I say. And just to do it again, because the police will refuse to take any accountability. It's a key part of the police's job that they defend relentlessly, as they have in case after case after case across the whole country, again and again and again. They defend their ability to kill people with impunity. They never get fired. They never take accountability. They never change anything. That's how they operate. They operate like a gang. They're a very effective gang, and they have the support of, the government, but the state or whatever. But anyway, I'm getting slightly off track. But the point is, it's so absurd, and people need to emphatically demand action. And I think the starting point has to be with the police, not the mental health services. My final comment: they listed the numbers of funding for Center County mental health service. I think it was like $4 million from the state or something like that. State College Police gets like $12.5 million, 3 times as much. Why, that's the money to give to the mental health services. They need a new bed at Danville. The cops have the money for it. Take it from them.
So, Evan, do you mind if we could talk instead?
Oh, okay.
Okay.
I
So,
don't think you're going to say anything very helpful, but go ahead.
no, that's fine. That's fine. Thank you for your comments. I think we're, trying to find the words to express how thankful I am for you being here. Sorry.
And I recognize that I'm upset.
No,
I
it's-
didn't know this person.
Oh,
I
no.
think it's upsetting.
No, absolutely. I think the challenge sometimes is you're in so much pain that you may think that so I understand you're frustrated. I get that. But the problem is, at the end of the day, let's say the officers are named. The district attorney has put out an investigation that said that they're not going to be charged. So that's the reality. That's what the reality is. So, and I will say this.
The district attorney can still press charges. If you don't press, it's not double jeopardy if you've never been charged.
This turn to
Sure.
talk, you're 5 minutes.
No, it's okay. Oh,
You can go ahead.
okay. So this, I know, this is maybe the point I'm trying to find, I'm trying to search for the words, is that if we aren't able to talk, we're not going to get anywhere. And so I understand that you want to pull back, and you don't want to hear that people are actually trying to make a positive impact. But that's the case. And I apologize. I didn't expect to be overcome like this, so my apologies. Can I borrow somebody's brother, Steve's, maybe?
No, Steve's is
Okay,
fresh. He's
sorry.
already stayed.
Yeah, no, and I don't know if anybody else would want to make any comments towards that. I will try to compose myself, yeah. No,
Well,
please, yeah, please.
I'm not sure if Evan wants an explanation of how the state of Pennsylvania is put together, but we're a Commonwealth, and so power is very, very, very diffused. Obviously, the police are supervised directly by the administrator for the Borough of State College, who is at least somewhat theoretically overseen by the Borough Council of State College. The reason why this particular event is concentrated in mental health is the county commissioners have a broad responsibility to provide mental health services to the residents of Center County. We have very little involvement with law enforcement directly, but we appreciate your comments. Obviously, they're being broadcast, and there are representatives from the Borough of State College in the audience. I don't know if there's anything you wanted to add?
No.
Okay.
Yes, please.
My name is Shirley Hassan. I'm from State College. I am interested in the community's welfare and in mental health. What I would like to present is a look at the loopholes. I see the community in many ways as waking up one day and finding this idealistic, wonderful, sunshine theatrical place where the sun shines, there are flowers, and everything is perfect. That's Fourth Fest, right? And everything is wonderful. There's music playing in the background, and you almost want to zip the perfect painted light in the morning, and you wonder if it's all real. But then that's the way I felt one morning. Everything was perfect. But that same night, after the sun went down, with the darkness settling around me, I picked up the phone and there was an anxious voice on the other side. And it asked if I could please come to their apartment. While that voice talked to me, another voice chimed in from the background and said, "And remember to ask for a ride to the Meadows." Thus began a long night's journey of my transporting an attempted suicide victim to an inpatient facility for her intake. It happened to be foggy that night, very dark, and my car wasn't actually, it hugs the road, so it was very bumpy. Daring rescue for her. Just because I was available, I was nervous. I didn't feel qualified. I really didn't know whether she and I would make it to intake that night. And there was some doubt, some risk that I took, not knowing whether she would open the door and jump out in the middle of the highway, or whether she would really stay and wait long enough when we got there to fill out the important papers that she needed to. But that was just me that night. It was a first of the gaps that I saw in the system, because this is an amazing community. The next was there had been a dosage medication confusion, and my son had arrived at the hospital that night in my daughter's car. He was in the back seat, stretched out on the back seat of the SUV, unconscious. I was in the front seat, my daughter was driving. There's no way to enter the emergency entrance to the hospital, it turns out, if you're not an emergency vehicle. We weren't. My daughter slams her hand, screaming at the ambulance entry. No response, nothing. She goes to the door, nothing. We could not get entrance. So she ran back over to the welcome spot where you're supposed to go in, and said, "You've got to come. We've got this semi-conscious person in the car who needs to be admitted." They said, "Go get her wheelchair." Well, she's stunned. She says, "Wheelchair?" And about that time, she and get in line because there are a couple of other people waiting for you to be triaged.
Sure, if you just one more minute for your comments.
One more minute.
Yeah.
To make a long story short, I jumped out and said, "He's dying." They still brought the wheelchair. The third loop occurred to me tonight. That same son tried to commit suicide about 30 times. And I never understood why until tonight, that he had stopped. And I wondered why. And I realized that his programming, his mental thought, because he's paranoid schizophrenic, was that in order to get help in the psych unit at Mount Nittany, he felt he had to be suicidal, and so he tried. He stopped the minute he left the state. Thank you.
Yep. Oh, please, absolutely. Oh, absolutely, sure.
I don't know if the microphones can be adjusted. We
Cannot hear, okay.
I don't know if it can be lower or turned up.
Sure. This one you're good on, right? This one you're good.
Which one do you want me to use? Can you hear me? No?
Do you mind? You know what we'll do? We're going to move this over.
Okay.
We'll do that. Sorry. Thanks for your patience. We'll do that. And
Can you hear me?
then we're going to do this, we're gonna do that. What about
Can you hear me?
that? So, yeah.
Okay. So,
I think we still need that. Yeah, so you want to go right next
Okay.
to it. Yeah.
okay.
Is that okay?
Yeah.
Okay.
So, hi, my name is Anya Lazaro. I have mental health issues. I used to live in the CRR, which stands for Community Residential Rehab. That is a supportive environment for people with mental health issues. I lived there for 2 years and had a great experience. I learned the skills that I needed to know to better function in society. But almost upon immediately arriving in the CRR, when I would be transitioned was discussed. I was lucky to get a spot at the Fairweather Lodge. This is a home that you live with 3 other people who have mental health issues like me. This is where I was developing increased independence. Without Fairweather Lodge, I may have to move. Without Fairweather Lodge, I may have had to move to an independent living situation sooner than I was ready. There are time constraints on how long a person stays at the CRR because there is not enough beds. That's a big issue across the board. What about the people who need support for the CRR longer? Do we just transition them out and see what happens? Or do we let them stay and not allow another person to come move in? I feel that maybe some CRR spots should be transitional and some should be more permanent. This past year, one of my friends transitioned from the CRR and a few months later he was killed. I feel that if he would stayed at the CRR or had transitional supportive living place, this might not have happened. When you live in a CRR, you have access to staff 24/7. When you move out, you are limited. I feel this is when you need more support. I feel we should have more CRRs and more Fairweather Lodges in our Center County. I stand before you asking on behalf of my friends to work towards increasing the number of supportive living arrangements to better transition support and better transitional support. We are like you guys. We want a roof over our heads, foods to eat, clothes to wear, and maybe employment. All in all, we need to have each other's back. If not us, then who will? Our county should be like a family, not a broken family. So I feel like not one of the problems, but there is a lot of people who want to get into the CRR. But there's a lot of people who need to stay at the CRR because if they don't, the OSASI thing might happen. So I'm wondering what we can do to better the transition, and like having more staff transitioning, because I feel that if we have better transitioning staff, then it may not happen. We have more support. What do you think about, and then I have another question, so what do you think about that?
Exactly what we're looking for tonight is what you just verbalized to this entire group. It's exactly that.
Thank you.
That's exactly as I write. It's exactly the kind of things
Okay.
that's just it.
Okay.
So I can't say it. You said it so much better, so I will not speak anymore.
Okay.
So
Thank you, Audrey.
Let me just, hold on, sorry. There's that, and then there's also, I have a question. I don't know if any of the CIT officers are here tonight, but one of the things that I feel that we could do better, and I don't know, and I talked to one of the CIT officers, and I'll say what they said, but I said, if we could have, instead of like, we would have the police, I know the mental health warrant, you have to have police come. But if we could have a de-escalator that's not a police officer, because when you come at a de-escalator, when you have a police officer come in the door and knock at the door, number one, their voice is raised. Number two, they're in uniform. So if we could have someone come in as a de-escalator that knows him or knows that person, that'd be great. But the other thing is, we don't want to put that person in danger either. So I was wondering what you guys, because I was just wondering what you guys would think. And they said that they are de-escalators, but I feel they should have someone come in. I don't know what you feel about that, how you feel about that.
Yes. What about you can't help people that...
sure, I didn't want to step before they spoke, so that's the only reason I hesitated. I just wanted to make sure 3 commissioners wanted to speak beforehand. I did not want to just speak. It's talked about a lot, and I recognize that it's talked about a lot. And so for us, it's really been that first journey that we've gone down to see what that really looks like. Because, you know, as I've asked other counties, they do that. Not a lot of counties do that at all. It is not the company. It is really our law enforcement, because it's a legal action, exactly like you said, that issues the warrant. So even across the Commonwealth, it is not a practice that occurs. And so it's really taking the time to have to go beyond Pennsylvania to look at what that, and we absolutely have to have that opportunity, but we first needed to look at Pennsylvania because of our act. And because of our laws, we have to be mindful of that. And so we started to look just within our own counties, our partner counties, to see if they've done it. We can then take that next step to look at it, what it looks like in other jurisdictions and what it means. The one thing I will say to that is like you said, it's non-uniformed individuals. Like you said, in a de-escalator. So we have to look at what that means in terms of staff, what experience, education, all those things that a person like that would have to have. So it's looking beyond our state to seeing how that is and seeing how we can actually have that happen in our state is an opportunity that we knew would be presented tonight and that we knew that we would need to look into. So thank you for voicing it.
You're welcome. That's all I have, so my friend's gonna go next, so.
Can you guys hear me? Make this higher. My name is Yum Yum, and I'm here to speak today and ask 5 questions. I understand the pain of Evan that spoke earlier. I was really good friends with Osazi. He helped me when my brother got murdered, and he also helped me because I've been in the mental health program myself. I've been on the waiting list for 2 years to get into a CRR, and I think that's unacceptable. And, a lot of people that are waiting, that want help, we're not getting the help. So what happens to the rest of us? It's hard to find psychiatrists, it's hard to find therapists, it's hard to find even peer specialists. I had 3 peer specialists through Peer Star, and they all quit. And so, a lot of us are struggling out here. Just because we all look a certain way, I may not look like I have mental health issues, but I seriously do. And my 5 questions are, my first question is it appropriate when you're serving a 302 warrant to cover the peephole so that no one knows who you are? Because what I know is when an officer comes to someone's home, they're supposed to announce who they are, and to cover the peephole when someone is already autistic and is schizophrenic and off his medications, it can startle that person. So I didn't know what the standards were for when officers come unannounced and covering the peephole, because I honestly believe Osazi had no clue who's at the other door. My second question is, it's not just Danville State Hospital that doesn't have a lot of beds. Even short-term facilities. I needed to go to a place, just a hospital, like the Meadows or whatever, and there was no beds available in Center County, in Altoona, in Johnstown. I had to go to Philadelphia and Pittsburgh, far away from my family and friends. So it was hard not having any help and services and then being stuck out there. So it's not just Danville, but it's even the short-term hospitals. There's just not enough beds. We're on waiting lists, sitting in the ER, not knowing what to do. So I don't know if there's any funding being cut, but when we're sitting in the ER day after day after day because there's no beds available, it becomes discouraging for all people, not just people that are going to a state hospital. My third question was the officers that came to give Osazi his 302 warrant. They weren't just regular officers off the streets. These were CIT trained officers. One was actually trained by the FBI. These people are trained into de-escalating situations, like Anya said. These weren't just regular people off the streets. They also knew Mr. Osazi. It wasn't just a random black person. They knew his mental health. They worked with him multiple times before, so they knew what they were getting themselves into prior to them coming to Mr. Osagi's home. So what went wrong within those 15 seconds when they covered the peephole, knocked on the door, he opened the door. Within 15 seconds, he gets shot 3 times in the back, 3 times in the back, and you cannot justify that. So I'm so confused. I'm so confused how these officers, who we can't name who they are because we don't know who they are, but how these officers were able to not de-escalate and shoot this man who's autistic 3 times in the back. Another thing that really upsets me about this case is the body cams. Yes. I mean, I've lived in smaller towns than this, doing my internship, and they all have body cams. How does the state college police not have body cams? we're supposed to just believe what they are saying. Body cams not only just help people, but it also helps the police officers for their own protection. So I think it's a good thing for everyone to be involved, to have body cams so that we don't have to be guessing what the narrative is. Because I want us all to be able to trust the police. You know, I was 302'd once and the police were rough with me, very physically rough. And I want people to feel comfortable when they are in crisis, or they have a son or a daughter or a mother or a father who's in crisis. I want people to be able to call for help and not have to worry about them getting killed. Because I know people are afraid. Who do we go to? I don't know who to go to. And my last question is, I believe for all mental health warrants, no matter who the person is, please do not bring guns to a mental health warrant.
Thank you for those comments. So in terms of we talked about it a little bit earlier, but the relationship between when a warrant is served versus when it's actually executed at the site, we're going to be looking at that further. And in terms of the more opportunities for individuals to be diverted for crisis services, we have a request for a proposal that was awarded to a company that's going to be hopefully working with us to have more opportunities for individuals to seek crisis services. But in terms of, again, we know there are folks here from the State College Borough. We're going to be taking those concerns to them. But thank you. Thank you. David, sure, David.
Hello, my name is David Sarp. Can everybody hear me? Yes. Right. I knew Ozzy. He was not my roommate, but I used to have his room, and let's just say that I knew him very well. One of his favorite words was lemonade. And I'm basically here tonight to understand, like Yum Yum said, why he got shot 3 times in the back, and also I'm trying to understand why his death, why did he even get killed? Another question I have is, or more or less a comment is, why was this happen? Why did it even happen? Basically, I surround myself with friends, I surround myself with people that care, and people that really do understand me. So what's up with Ozzy? What happened to lead to this? Why did it even happen? That's basically my question is why? Why, and why did it even begin? Why did it even happen? That's my question.
That was my son. And my big question is, how can I keep that from happening to him?
Was there, okay, yes.
You should get full shark behind me tonight.
That's fine. Yeah.
But I understand some of the background of Ozzy. I know that he had, I guess, in some way, if I'm wrong, somebody could correct me, was suicidal. He had told his parents that goodbye and all that. But anyway, to just get to the point of it all is there any other alternative shooting somebody that they could have done? Was there any other position they could have taken to not hurt someone? I've heard people say it's a black thing. I think it's a black thing, and it's also a mental illness thing. So I just want to know, what other alternatives could they have had?
So I would hope that every single, we can't speak on behalf of law enforcement, but I think the commitment we've seen from law enforcement entities in Center County to become part of the crisis intervention team training. There's actually a training that's going on recently. So we're going to be adding more individuals who have, again, more tools in their toolbox to de-escalate. We've had the opportunity to have many officers who have gone through that program who have successfully de-escalated. So we do know the program works. I would hope that as we go through, and again, I'm going to be I know that there are concerns, and this is my hope that in a year from now, when we look back on the task force or the coming together as a community to try and improve the relationship between mental health and law enforcement and the community, that we'll actually see positive effects. So that would be my, I think our hope is that if we go through that process, if a year from now or in 6 months there's no action, there's no tangible effects of benefits, then I would be wrong. Many of us would be wrong, but I do think that's the best vehicle to do it. I don't have another solution that exists. If there's another solution about how do we improve, we are all ears. So yes, we're going to keep that training occurring. But thank you to the whole family for commenting. So yes, ma'am.
Hi, I'm Cindy Keith, and I'm from State College. And I want to thank the very eloquent young ladies that were speaking here a minute ago. Okay, just some questions. Will the task force be working closely with the police? I mean, that's a given, I hope.
Yes,
and
yes, they do.
Okay. Is funding the sole reason for the wait times that people seeking mental health services can't access them because of funding? Is that the reason?
It's not only funding, it's availability of our providers. We rely on agencies and hospitals and clinics and psychiatrists to offer the service in our community. So it's not just funding, it's actual availability of those services.
So what's preventing the hospitals and psychiatrists from jumping in there? Is it because they're not getting paid?
There's a limited number of psychiatrists, and I will say this nationwide, and I don't know, there is a drought of psychiatrists nationwide. It is not a practice that a younger generation in our medical field is going into. Overwhelmingly over 50% of psychiatrists nationwide are over the age of, I believe, 55. So it is a gap in our nation for those psychiatrists. So we know that, but that is one part of it. It's also, healthcare systems adding on and wanting to do additional beds, like they had talked about previously about needing hospitals, short-term beds. When you talked about that, we have to rely on those businesses, those healthcare systems to do that. And so when they do, we can work with them. But it is equally not just about the funding, but it has to be the availability of not only just that, but the staff. So we need nurses, we need direct care workers, we need all of that to give that 24-hour care of hospitalizations. And so we have to rely on a healthcare system to provide us those opportunities. And I can't speak to them, I can speak to just what we have to work with.
Okay. The mobile response unit that you spoke about that's available, I hadn't realized that even existed, and it's in Center County and it's for a continuum of care. Is there a way that can be utilized so that when police get a call to interact with a mental health issue or crisis, can that unit be mobilized to accompany them to be the de-escalators that are needed? Because, as you said, that it's not only that the safety of the person with the mental health issue, it's the safety of the police officers as well. And more support in transition, I've heard that time and time again. I don't know what the answer to that is, but I'm hoping that the task force is going to entertain that question as well to try and find out. And I also, I have these cards that list a phone number, an 800 phone number. It's free, confidential, 24 hours a day, 7 days a week. The source is SAMHSA, SA, and it's help with substance use disorder for you, your family, for medical advisors. This is a nationwide organization, and I think this number should be included in your little purple booklet.
Yeah, so SAMHSA is our federal partner.
Okay. So
they're the federal government division of mental health and substance abuse for us.
And so that's a dual diagnosis thing. So I have these cards, and people are welcome to have them if they like. Thank you.
There's a table out there if you want to put them out, and then I'll make sure to grab one so I can have that copy. So thank you.
Thank you.
Sure.
Thank you, Cindy. As we summarize the meeting and summarize our discussion, we're going to have, again, if we publish the questions and comments that were asked, there's going to be a big heading for topics for the task force to consider. And so absolutely transition services and that a more intensive mobile response unit. So thank you. All right, keeping going. Yes, please. Oh, they're okay. Yes, please. And we'll put another call out for folks who are downstairs that would want to ask questions. Feel free to make your way upstairs as well. And we'll make sure, if Margaret, if you can let send them up. Okay, good.
Hi, my name's Rebecca Shepsky. I've been here for 7 years. I was a case manager in first episode psychosis in Australia for an internationally leading program called EPIC. I encourage you to look at their program. It's doing EPIC or Origin Youth Health, and it's the EPIC program, early prevention for first episode psychosis. We worked with 15 to 25-year-olds. I see a lot of gaps in your system compared to what we do. You speak about continuity of care, but you're talking about people who are unwell and unable to advocate for their own health care. So you're putting all of the expectation on the person to go and get a service and they're too disorganized to do it. The burden needs to be on you to go out and engage the person. So we knew that the outcomes for that person, I think it was like in excess of 80% of like how well that it turned out for that person depended on whether I, as the case manager, actively engaged them. If they liked me and trusted me, I could get them to take their medicine. I could get them to do all kinds of things because it's about relationship, right? So we had huge amounts of training on that. Like, what does it look like to actually engage a person in treatment? What does it look like to be a likable case manager? If you suck, they don't want to go and get care from you. If you don't know how to relate, people can get degrees and they can look good on paper, but if you don't know how to engage a person, you can't do it. You also have, you need to advocate strongly for laws that allow mental health professionals to act in ways that they know they need to. So a lot of your professionals know that they need to admit a person, they know that they're a risk, but they're not imminent. They don't reach the high standard that you've created. And so you've created a system where they have to, you're asking for crisis. You're saying in order to provide care for you, you have to be in crisis. There's this huge middle gap of medium to high risk and a whole bunch of categories that we already know. The data's already out there. It was out there 13 years ago when I was a case manager in Australia. So you're about 2 decades behind. So risk is not just defined by imminent violence, the risk of imminent violence. It also includes things like if a person is intoxicated, if a person is actively detoxing off a substance. It includes if a person has been violent previously in the context of active symptoms. So if they're active again, it's really likely that they'll become violent again. People's delusions tend to replicate themselves. We know this. This is not new. Your definition also fails to include deterioration of mental state. So you're saying to a person, I don't care if you're actively receiving brain damage right now. I'm not going to act to care for you unless you are a threat to yourself or somebody else. That is not dignifying to the person. It doesn't say that your mind matters, your brain matters, it's beautiful, it deserves respect, it deserves good care. The person can't act to get it for themselves because the nature of the illness prevents people from recognizing that they're sick. Your HIPAA laws. So HIPAA laws regularly and significantly hinder the involvement of those who act as primary carers from contributing to their loved one's care. At times it even prevents them from knowing where their loved one is. So my brother-in-law was admitted. They wouldn't even tell us that he was there. I had the most helpful information. They had no information on him. The only information they were relying on is what they saw in that moment in the hospital. That slows down the process of that person getting care quickly. You also ask a psychotic person to sign consent to give information when a psychotic person is not able to give consent in law, right? You're saying, but because the signing consent thing is not to protect the patient, it protects the hospitals from the legal ramifications if someone sues. So we're not putting the person first, we're putting the legal protection of hospitals first, and that's a problem. So my brother-in-law was discharged and told, go get a psychiatrist. And he didn't want to because he didn't think that he was sick, because that's what mental illness does. And he died. He got hit by a car because he would drive erratically every time he got in that car. And I knew what needed to help him, and I was on the other side of the ocean saying, go get this, but it wasn't there. And he died. And my last point is that you'll attract psychiatrists when you provide a system that allows them to actively help. While imminent risk is the bar that you insist upon, they can't. Thanks.
My name is Vernon Davis, and I reside in State College. And the words that the young lady before me just eloquently said, I echo those sentiments, because that is exactly what I am and my wife and I have been going through to this moment. I also want to talk about the HIPAA law, because as parents, we want to work in concert with the physicians and with the psychologists and psychiatrists. But as the lady before me just eloquently said, she said, you know, my son was finished college, 2 degrees in 3.5 years. But right now he's suffering. But he's smart enough to know, but yet still out of it not to know a whole lot of other stuff. And there's so many rights that he has that as parents that we want to help him with that we can't. If he says to the psychiatrist, or if he goes to the hospital and says, I don't want them to know anything, they will tell us absolutely nothing. But yet we are charged, number one, still on my medical insurance to pay the bill. And I said to them, I said, what if I decide not to pay you? Will you still give me information? Well, you know how that goes over. But my point is, where does the help come in? If we're going to help and be advocates for him, and we see all that happens in his life, and like the lady said, he goes there and tells them what they want to hear. So they don't treat him right. There has to be something, some change in that law. There has to, because it works against the parents. It works against those that love the individual to help them. And I got to be perfectly honest. I've been to your meadows, and I tell you, it's terrible. The meadows is terrible.
They treat like animals.
It's terrible. The facility is substandard. I think they're understaffed. And they're very unprofessional. The caseload is too much, and I think that's something that everywhere, and we called to try to get him to see a doctor, a psychiatrist. It was like 2 months. Was it how long? 4 months. And I want to say this too. You know where they can probably get the most help is where they don't need to go, and that's Rockview. What we have done, we have traded one for the other. We have traded the incarceration for the mental health. And at Rockview, they have a whole entire ward full of people who are suffering with mental health that should not be in there. We've done these people a disservice. We've locked them up and incarcerated them when they suffer from mental health because they go out and do something that is benign, that is stupid. And what we do, we slap them on the hand, and the problem is that most of these people don't have the backing of loved ones to stand and advocate for them. And so they get sucked up in the system. They get sucked up in the system, wind up incarcerated somewhere, and there they stay drugged and out of their mind for the rest of their life. And I tell you, I refuse to let that be my son's demise. I refuse. And so there's a couple fronts I think that need to be looked at. And so we can avoid tragedies like the one we just experienced. And I tell you what, we have a broken system that's going to take people from all over, from all aspects, looking at this, to be able to combat it, to defeat it. Because this is just terrible. And the way that we're treating our people with mental health is terrible. They need a voice. And I tell you what, you'll have my voice, because I tell you, what I've seen is wrong. What we do with these individuals is just wrong. And to have, I want to say that, and I'm quitting, but to have police show up, and if you have any kind of, and I'm going to speak on behalf of black folk, we don't believe that police are on our side. So if you come to our door, I don't think you're coming to protect me to start with. And to have you show up in uniform and want to, it leads to bad things. So I'm just saying, this is a broken system, and we need every hand on board, every hand on deck to resolve it and to solve it, because if not, I'm telling you, we're going to see more of this happen, and more people get incarcerated over stuff that they should never even be in our prison system or in our judicial system over.
Hi. I kind of agree with everything my husband's saying. I'm frustrated. I'm not getting help for my son. I'll call you guys, Senator County, Pennsylvania. Guess what they say? Call, can't help. Can't help, can't help me. They can't help. They don't do nothing. You know what they say? Go call, get a 302, send them to the hospital, and they're coming right back out. Then can't help, don't want to help. I'm tired and I'm frustrated with no help. It's sickening. Then they say, well, your son or your loved one had to be suicidal, all right? What they want them to do, kill their family member, then they say, I can help? Is that what it takes, someone to kill someone? It shouldn't be that way. It shouldn't be that way for my son to be suicidal or to be homicide, to get help. What kind of mess is that? I called you guys, guess what you said? Call, can't help. Can't help, can't help. And I'm sick of can't help. Only thing they'll say, is he suicidal? No. What I say, I told him, I gotta lie? Do I have to lie to get help? I don't believe in lying, but do I have to lie? Do you want to lie to get help for your loved ones? No. Well, why we gotta lie? To wait till them die or someone else is hurt? I hope y'all take this seriously. This is just a panel. Just be a panel. Take action. We need action. action. All this money stuff, all this other stuff on this, I was disappointed. It's like, I didn't come here for that. I need help with my son. I don't care how much money you got, do something. I want something done. I'm gonna call tomorrow.
I think it's time for this side of the room now.
Sure,
Pardon
sure.
me. Thank you. My name's Chris Platalevo. My wife Peg is hiding. I want to thank the committee. A lot of words have been stated here. The young lady over here, that was beautifully articulated. Well done. This obviously is a highly emotional topic. I wanted to come up behind the two folks here. My daughter is going through a lot of crisis. The whole 302 process is, first off, what works is we did call the crisis center out there. The staff was responsive. They came to the house. They interviewed us, interviewed her. They processed the 302. They got it signed off. The police officer showed, took her to the hospital. My wife and I are finally going, my God, thank God she's going to be taken care of. At about 1 in the morning, an ER doctor released her. 8 hours after that, she was in jail. We were the fortunate ones. There's a good friend of ours in this room right now that the outcome was different and did not survive the ordeal. That said, 8 hours after she was released, she was in prison. She was sentenced to 4 months in jail. We petitioned through a good attorney in town, and the judge agreed that if we could find a dual-track program for her to go in, that they would release her immediately to go into the program. This was an exercise in futility, and the first point I want to make, question to the council, something I think can be fixed fairly quick, is 3 times a bed became available. They only hold the beds for 12 hours, we were told, and it takes 48 hours to process somebody out of the prison down the road. 3 times, and you heard from the group here how hard it is to find a bed. 3 times we were denied. Why can't they process the paperwork up to the point that the bed's found, and at that point the final signature is done, and that individual can get the correct care? You're absolutely right. We're Great Britain in the 1700s. We don't know what to do with the mentally people that are having problems, so we throw them in jail. My daughter went in jail and came out, now knows how to pick locks, found out that if she huffs that it's harder to detect this. And because the doctor said, I'm not signing the 302, just today we received a phone call from her because some of you may not recognize me. I was on the front page of the Sunday paper. She's livid that I'm trying to advocate to get help for her. And she said, I have no problems because they let me go. So I feel your frustration over here. I do need to say this. I served this country for 26 years with my wife in the United States Army, and I saw the police officers come to our house. We had them at our home 5 times over a period of about 2 to 3 weeks when this thing just started to get totally out of control. The last time that they showed up, my daughter actually shoved a police officer. I actually grabbed my wife. We took a step backwards because I was convinced all heck was going to break loose. They de-escalated the issue. They escorted her out of the home without any additional injury to her. I can't speak for anything else other than what I personally witnessed, and the officers on that day and that time period conducted themselves professionally. And the only thing I can advocate to you is that from what I witnessed, they want to help. I think they were placed in a position that just went from 1 minute left to from chaos, and the people, I think, is a valid comment. I really do believe that. The last thing is the meds, the HIPAA. You're spot on. My daughter went to Cove Forge and then Pyramid. 90% success rate at Pyramid if there's a transition program in place. There are no homes in State College for this transition. Furthermore, when we picked her up, they handed her a paper bag filled with meds, not in bottles, just loose meds in a paper bag. I said, what's the dosage and the frequency? Oh, I'm sorry, we can't tell you that. That's covered under HIPAA. This is a person that's got a drug and alcohol abuse program. We had no idea what she was supposed to take, when, where, and how frequently. So I'm done. Peg, did I miss anything? You have 5 seconds. Thank you, dear.
Why is there no detox in State College?
Oh, that's a good point. We wanted a detox program for her when we first brought her. The hospital has no detox program. I don't know if that falls under a trauma care, and they're not trauma care certified, but my God, we're a Big Ten school here and there's no detox program? That could be changed. That should be fixed. Thank you.
Just in terms of detox programs, even though there aren't, in terms of the availability that center we contract with, can you talk briefly to that?
I just got to shift my brain. I'm
No,
sorry,
no,
Michael,
no.
for that.
No, of course.
So we do not have any local nearby. It is a matter of availability of where they are. They are in neighboring counties of ours, as you said. I think Blair County is the closest county to ours. I'm actually going to stand only because I want to make eye contact with an employee of mine to make sure I'm right. We have them in Blair County. We have White Deer, Run, like you said, Cove Forge, Pyramid. So they are not physically located in Center County at all at this time. The providers have operated outside of our community. So we contract with as many of them across the state as we can. So when an individual comes and they have a bed in one of those facilities, we can make that connection with them. So we actually do a lot of contracts with a lot of them throughout the state. So when there is a bed available and an opportunity, we do that. It's a little bit different than typically what we have here is who we contract with here. But we don't at this time have any detox. I just wanted to make sure I had that right. So.
And I'm sorry, I apologize, but
no, it's okay.
as the person under that treatment, they're uprooted out of the community.
Yes.
And that she absolutely wanted her friends and loved ones to be around.
Yeah.
I'm sorry, I'm not.
Well, it's all part of treatment. And it's the engagement, the family visits, it's all part of that. And that distance can make that very difficult for families to have that opportunity. So, heard that.
Why isn't there one here? I mean, immediate detox. If you have a child that has been drinking for days, they go to the hospital and they put them back out. And they could go into DTs and die.
I cannot speak to
Okay,
why
so
we
we have
don't
35,000 people under 25 years old on that campus, and we don't have a detox. There's something wrong with Penn State College, all the townships. There's something wrong.
Thank you.
Somebody needs to get their hand back there. I can't see you. I'm sorry, I can't see. Yeah, please, yes, yes.
Hi, my name is Eva Letwin. I live in State College in the borough. I'm a mental health therapist, and I'm also a concerned community member. First of all, I wanted to say thank you to all of you who shared your pain with us, because it's really moving and it makes us real. The statistics may be interesting, but your stories, they matter. I prepared a statement because I'm nervous, as you can see. A young black man in mental health crisis, a concerned family, a call for help, a scared person with a kitchen knife, 4 shots. No de-escalation, no preserving of sanctity of life, and then no accountability. It didn't have to end like that. Experience tells us it might have gone differently if the young man with a disability had not been black. Experts on police training tell us it doesn't have to end like this if police are trained to de-escalate, to slow things down, to not view repositioning as retreat. And I read that from a police manual. Mental health professionals know there are better ways. The idea that Osazi's death was justifiable because he defied orders goes against everything we know and understand about the brain. Individuals who are in the midst of a mental health breakdown do not process orders. and information the way you and I do right now. Or the way they probably could if their illness were properly managed, which of course often includes the medication. So imagine the prefrontal cortex, the amazing part of your brain that's responsible for impulse control, for knowing right from wrong, for rational decision making. That's not really on during a mental health episode, such as Osazi experienced. The limbic system takes over, and that's the seat of our emotions, the strongest of them, fear. Mental health professionals know that it takes time to calm down and reorient someone who's acting so purely from the limbic system, that so-called reptilian part of our brain. Actually, everyone here who has a toddler, who has ever parented, knows the same thing. No reasoning with a toddler while they're in the middle of a temper tantrum, right? It's not all that different. Would you justify shooting a 2-year-old because they did not follow your orders? If the police officers responding to a 302 call do not understand this, then they're not properly trained. And if they're lacking in proper training, then why are they there to respond? My demands, and I think these are the demands that many of us here share, train police officers in de-escalation, especially when there are no firearms on the scene. But at the same time, utilize and work with mental health experts when going on a mental health call. And this is not a wheel we have to invent from scratch. Across the country, other states, municipalities are already making progress on this front, working fruitfully with mental health experts. Models can also be found in other countries, and we heard Australia. I'm from Germany, all over Europe this is done, where de-escalation is the norm. It's not just a technique or skill that you learn for a week in special training. It's a mentality. We demand that you, our representatives, the law enforcement, the DA, get to work on coming up with a better way. Because Osazi's life matters.
Can you hear me? I'm not a very loud talker. My name is Mary Ann Taylor. I'm from Bellefonte. And I know this meeting isn't about the new Crisis Assessment Center, but you mentioned it, so my question is related to that. I know firsthand that Center County offers crisis intervention. Mount Nittany's ER and behavioral health unit provides excellent care for crisis intervention. So my question is, why are we wasting taxpayer dollars on providing service that we already provide when patients get out of 3 South, the mental health unit at Mount Nittany, and need further care? And the closest partial stay place is Pittsburgh. So what does the family do? Move to Pittsburgh so that their child stays alive. There's no partial stay. And I thought that you mentioned that the state requires partial stay or intensive outpatient services, and we don't have it.
So partial hospitalization, as it's listed, is not an actual hospitalization service.
Right.
It is a day opportunity for individuals to go to.
Right, which we don't have.
Which we don't have because at the time, we really had kind of really converted to that recovery model of psychiatric rehabilitation. That really had been
But you can't fix it in a week.
Front of it. And I understand that the idea behind psych rehab is really a philosophy that went away from that treatment model that partial hospitalization is, very similar to the treatment they get inpatient, groups engaging with individual psychiatrists. That is the model that is inpatient, and that was the model that is partial hospitalization in most of them. But we had really seen the benefits of our psych rehab program assisting individuals. And so we really went in that direction.
And what would that look like for someone getting discharged from Mount Nittany? What does that look like?
So they are typically at Mount Nittany, and I would speak to them, is their social workers work with the individual that are there in the unit to educate them on all the services in the community. So if an individual is interested in going someplace, engage with individuals every day, provide support, psych rehab is a referral that they make. We have multiple different programs in our county. So it works with them. They do the referral with them. If they would need financial assistance to cover it, they contact us to do that. They link them with case management. They link with an outpatient. All of that's done with the social workers on Mount Uni's psychiatric unit prior to discharge.
So if I'm understanding this correctly, there is a place for someone to go and attend daily in Center County.
So our programs, some of our psych rehab programs, and I keep using that abbreviation, run up to 5 days a week.
Where?
So I would say Clubhouse. I would say Community Services Group has a psych rehab program in State College as well. There's Clubhouse as well. Phillipsburg has a site-based program as well that is run by Skills, and they also do mobile psych rehab, which actually goes into the community and into people's homes and engage them in that psych rehab model.
I would like information on that.
It's all in that purple book. We absolutely outline all of our psych rehab services. It's page 28.
So someone just picks up the phone and calls these places and don't have to go to travel to Pittsburgh 3 times a week or 4 times a week?
No, so they can always call the county. We can have that first conversation with you, absolutely. And just about crisis assessment, just because it's new and Commissioner Pike mentioned it, it's also about individuals who are not necessarily going into the hospital, but who need that crisis support and an immediate type of support that's not necessarily going into our hospital setting. So while Mount Nittany treats individuals and they do crisis services, as you said, at their facility, our center is about meeting people in the community prior to them going to that medical facility for it. So it's about, it's an opportunity for us to engage in people in different ways prior to a medical facility being where they engage with somebody in crisis. And that's what that center is to be. So they do that already, but we are looking to enhance it. So mobile is what we talked about earlier, emergency services. They already do that. They do mobile. They go out in the community, they meet with people, they engage with them. They do it as a walk-in, they do it as a phone, and they do it as a mobile. We are looking to take that to one additional opportunity and center because we cover a very large county. I mean, we are a large county from the whole way down the Woodward to Phillipsburg. It's a lot. So we were looking for additional opportunities. We've heard about this from individuals in our communities. We heard about it from law enforcement, education. It's been looked at for a long time because we needed another opportunity for people to be engaged in crisis, who needed a place to go that might not necessarily be our ER, but who need some kind of support, whether it's 2 a.m. or 4 a.m. And having a center and having some place to go is an additional way to meet that need. It might not be at a person's home, it might be at that center. And so we wanted to supply that opportunity to have that service in that community. So that's kind of why we created it.
I think the census here is we need help after that.
So the aftercare
ongoing
part too.
help,
Okay.
not just the
Upfront
first day.
crisis, it's the
afterwards.
And I've been writing that down. Okay, thank you. But make sure you get a purple book about those services. Okay, they're in there.
Hi, can you hear me?
Yeah.
This one? Okay. My name's Stacy Garbrick. A lot of people don't realize this about me, but my stepson is autistic, and I took care of him for 4 years. Currently, he lives in Mechanicsburg with his mother. But the 4 years that I took care of him, I traveled to Clarion, I traveled to Pittsburgh, I traveled to Erie, and I tried to go to the Meadows, but the Meadows wouldn't take my stepson because he was violent and aggressive. And, he was a little kid at that time. He was probably 6, 7 years old, Now he's 16. So I think my thing is, so what happens when these kids age out, when they turn 18 and they're adults? And then you have the same problems that you had when they were little kids, but the problems are worse. and you try to get a bed for them, and you can't find a bed for them. There's nowhere for them to go. And then they are called on a 302, and then police go into an already volatile situation and make it worse. And I don't want this to happen to anybody else. I don't want this to happen to my stepson. I don't want it to happen to anybody in this room. You know, and I just think we need to do better as a community. We need to have more services in Center County. And that's all.
Thank you, Stacey. Thank you.
My name is Ron Dotz. I live in Spring Township. I've got to tell you, there were a lot of great points brought up here today, things that I hadn't thought of. I don't think there was a lot in the way of nuts and bolts of how do we fix this problem. And I'm hoping that what we're doing tonight is just the very first step in a long process. Good change takes time, and we've got to be patient with this, but we've got to get to work on it. My story, my family's story is brief. I'll be brief with it. My grandson, Josh Bathgate, took his own life May 4th. And I'm going to give you that background because it's important you understand this. His mother has done, my wife and his grandmother, Sue, is here, his mother, Sharon Bathgate, his brother Jesse, and his father Kevin, they're all here and are in support of this. But he had been diagnosed schizophrenic, as we've heard a lot tonight. And it's been a long siege. We think that this was developing when he was maybe, as early as 11 or 12 years old. There were signs that we didn't understand. So he's had a number of episodes with 302 calls, and I've never heard of this thing until our tragedy took place. But let me just give you the chain of events that took place, because it's important that you understand this. The chain of events that took place on May 4th. He had a little apartment in downtown Bellefonte on Allegheny Street here. He had a kind of an interchange, we'll say, with the local police about 3 a.m. His mother, Sharon, has done everything she could. Josh was very dependent on my wife, Sue, his grandmother, and he called her at 3 o'clock Saturday morning, May 4th, and she went down and picked him up, and the police were there, local police. So she brought him home, and he got settled in maybe 4 or 5 o'clock in the morning. Then maybe 7:30 in the morning, we heard some rustling around. He dove out a second-story window, believing that a group of men were in the house trying to kill him and his grandmother, and somehow to find his mother as well. He ended up running across the roof, the second-story roof, stood on top of the roof, all cut up by having dove through the window. We called police, of course, called 911, called police. Local police came. EMS came. Fire police came. All of those folks heard the interchange that was taking place 7:30, 8 o'clock Saturday morning. He was on top of the roof. By this time, I was outside. We have a camera security system in our home, and he knew that. And he said, "Pap," he's talking. I'm on the ground. He's on the roof. He's talking down to me. He's, "Pap, you got your cameras on, right?" And I said, "Yeah." "You'll see them. I mean, they're in the bathroom. There's 4 of them, and they're trying to kill me. We've got to do something." And the local police, all the people that were there, were very calmly and as professional, I think, as they could under the circumstances, talked him down off the roof. He got into the EMS vehicle. They took him to the hospital. I don't know about what time that was, but every person there witnessed the chaotic nature of his mind at that time. His mother called to the hospital and pleaded with them to keep him there, a 302 call. And I don't know who was involved at the hospital, but there was, apparently they were trying to do something for him, but under the circumstances, under the guidance, I think, they weren't able to. A few hours later, the hospital 8 hours later, the hospital released him without telling anyone, telling no one. 2 hours later, he went to his mother's house and he killed himself. So my question is, what is the system that we have that allows that to happen? And I think we need to look at every single moment of that day. And I skipped a step here, actually. He went out, he left the hospital himself. He got to a location. Sharon asked the police to find him. They found him. They called Sharon, his mother, and his mother again pleaded to take him back to the hospital. And the answer was, he's fine and we're letting him go. And 2 hours later, he was dead. So this is, I've heard the term a broken system. We have a broken system here. We need to fix this. I'm sorry, I don't mean to take too much time. If I can have just a couple of more minutes here. So I think a lot of great things were brought up here tonight. A couple of things I want to mention is it was not at all clear to me when we talked about the difference between 201 and 302 and all the things that we talked about were very confusing. And I think what we need is another group of people in the professional area and in the public, in the public's interest, to really look at this and figure out what it is. How did this happen? What part of the system allows that to happen? That shouldn't happen anywhere in the United States, really. So that's my point. Just a couple other things. I'll tell you, the comments from the young lady from Australia and the HIPAA comments that were made, I'm not sure who you were. These were great comments and so true. Really on the right track. And another thing that just caught my attention, I think we need to get behind the numbers here. We apparently have funding in the neighborhood of $4.4 million, and I see such small, what looks to me like small numbers, relatively small number of peoples that are hands-on cared for. I might be wrong about that. I might have misunderstood the numbers. But I think that we need to take a look at a breakdown of where that money is going. How much of that is really true hands-on care to people who need the care versus how much of it is administrative stuff. And maybe there needs to be some guidance there. But I certainly hope that this is only the first step in the process. This needs fixed. Thank you.
Hi, my name is Dan Letwin. I live in State College. There's a lot of pain in this room tonight, and it's palpable. And my respect to those who have been so vulnerable as to share their stories and the stories of their loved ones and their friends who have been victims of a system that is not sufficient. I think there's an elephant in the room here, and it's inseparable. We can't escape politics. I see and I share the frustration that many people have expressed towards our local officials. Why don't you do more? I sense that there is enormous goodwill among our officials. But at every turn, I'm not an expert about the budget, but at every turn, I see that our administrators need to work with the resources that are available to them, and clearly they are not sufficient. What's the population of Center County? 160,000, 6 beds, 7 beds, what was it, at Danville? It seems to me that there's many different ways of getting at the solutions, and it's also, the other elephant in the room is race. Quite clearly. Sir, I understand you had a very affirming and good interaction with the police when they came to your door. I believe, oh, yeah, you, yeah, oh, both, and I believe that. Yeah, there is a, and I believe that, and Osase didn't. But it seems to me that there is an undeniable need in this community and other communities around Pennsylvania and frankly around the country for a more serious commitment to the kinds of services that the woman in Australia described. I don't know if she's still here, my wife from Germany, and that we cannot escape the politics of our times that gives tax cuts to wealthy people so that it's not necessary to provide the kinds of services that are so obviously needed. So among other things, it seems clear that to talk about these issues and to not talk about doing all we can to vote in, to bring in a legislature in Harrisburg that will be inclined to provide, to tax, to ask us as a people to contribute for the provision of the resources that are needed, that's just a vital part of what we need to be talking about if we're going to if we're going to come up with solutions to the kinds of grievous and very moving problems people have talked about.
Good evening. My name is Lorraine Jones. Can everyone hear me? Yes. Okay. And I just want to reiterate something. Dan kind of pointed it out, the elephant in the room. We really need to talk about race. You know, we talked about mental illness, but there's the intersectionality of race and mental illness. And when we talk about building these task force and working on these issues, State College tends to have a short-term memory. You know, they'll do it for a little while, and then all of a sudden, they kind of forget. And so when we're talking about working on these issues, we really need to talk about what are we going to do to make sure that when we're forming these task force, when we're working on these issues, that race is at the center of what we're doing. You know, I want to make sure that we do not forget about that. It needs to be at the center of everything that we're doing. If we can bring African-American basketball players, football players here, we can start employing people of color to come in our area. Okay, that's part of the issue. But also, we need to be committed to work on these issues, committed to talk about courageous conversations about race. You know, and so I'm wondering, as the commissioners, what are you going to do to make sure, to ensure that race is in the front and the center of these issues when we're talking about the intersectionality of mental illness and race?
So in terms of just in general or specifically with this task force? Yeah. So our understanding is that we have law enforcement, racial bias, racial inequity, and mental health. So the way that we can play a role is to have those three come together to have discussions around those. I would hope at that task force there'd be working individuals will be working together on each of those things. So we come from the mental health. We have mental health experts. We have mental health providers, folks who we have employed, so we can bring them to the table and have those discussions.
I guess what I'm asking is also, are you going to have people of color involved in those conversations?
Absolutely, 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 yeah, yeah. How would help me? How can we go about that? Because we would want to do that. We want to have the most inclusive folks, that organization, that committee looking at every issue. How do we do that?
I think
Yeah.
we've had several experts in the room. We had Pastor Vern. We have people that have relatives people of color that have relatives that are struggling with some of these issues. And so I'm asking, is that going to be part of the task force? Making sure that you have a proper representation of people of color within that task force.
Yes, yeah.
Okay.
I mean, I don't want to speak on behalf of the Borough State College. We want to bring folks who are experts in mental health and individuals who have experienced mental illness and have their stories to tell and have that be a part of the dialogue.
And I think
so
part of those
I don't.
Is family members that have family members that are dealing with mental illness. Sorry to cut you off.
No.
Yeah, I just want to make sure that was at the front and center. And this is not going to be something that's here today and gone tomorrow. This is something that we're committed on working on.
No, I would certainly hope that on the county side of the task force, we reach out to a variety of communities. We have persons with lived experience, always important in addition to the experts. And of course, I would definitely urge the Borough of State College, for whatever task force members they appoint, that they also consider race, socioeconomic class, gender, a broad variety of other factors, but most importantly, the lived experience. I think that's very important.
Thank you.
You're welcome.
Oh, sure. All right. And I apologize for this. Are there folks who are downstairs who are in the back waiting to speak? I apologize. There are seats up here if you wanted to come in and take a seat up front. I apologize about that. Okay.
My name is Laurel Saunders, and I live in State College. And first of all, I'd like to say thank you to everyone who works in mental health. I know many people as individuals are truly giving their best or trying to give their best, and I respect that very much, although I think the system itself is sometimes the enemy. I'm a lucky mother of 2 girls in their 20s, and I'm a lucky mother because my oldest one, and this is the first time I'm speaking publicly on this ever, has allowed me to speak tonight about her. She's living in San Francisco, California. She's a human resources an HR recruiter for a software firm, doing very, very well. She's very lucky. I have 4 points I'd like to make. She has rapid cycling bipolar disorder, and we think, in retrospect, many years ago, doctors too, that there was a very early onset and it was not recognized, and then it was misdiagnosed, and then the wrong medicine was prescribed for 7 years before it was discovered what she had. So there are 4 things I'd like to say, although there's much more I could. One of them is, I think the schools, even though the school counselors really try to do their best, they need some support. We had an experience where our daughter was having seizures, non-epileptic seizures, but very real seizures, lasting sometimes a few minutes, sometimes lasting as many as 45. And they were happening everywhere. People thought she was pretending, she was looking for attention, all kinds of things. Well, what ended up happening is when they happened, she was in 10th grade going to Penn State to take courses in Chinese. She graduated from high school just 2 courses short of a minor in Chinese. Very linguistically talented. And she had these seizures at school, seizures in gym class, seizures in class and on the bus. And the school's response was, and I love State College, it's hard for me to say this, their response was, we can't have these seizures happening in our school. We can't have these things happening because it endangers the other children. You're going to have to stop these seizures from happening, or you're going to have to homeschool her, and we will send a tutor to your house 1 hour a day, which meant my husband, who's brilliant, but not one to do that sort of thing, and a child that would not listen to her parents due to the condition that we didn't know she had, was being asked to be taken out of school. Doctor threw medicine at it, trying anything to just quell these things from happening. And they stopped happening, but it was the wrong medication, and it accelerated the disorder, and that is probably not reversible. The second thing is, and this one I'll just touch on, the waiting times are incredible. My daughter was talking to me just yesterday, and I told her I was going to come. I asked for her permission to speak. And she said, people need to understand when a person has a mental illness and they say, I need help, they need help, and it cannot wait. And they need to learn not to judge us for what is happening, but just to hear us. Just stop talking and listen. And we tried everywhere to get her help. We were looking at Johns Hopkins. We were looking all over the country, anywhere. We said we have some means we can get her somewhere else. 11 months, 13 months. She was in Japan and she needed help. She got home, she needed help. We can't get her help. It's going to be 4 months, 5 months. We got lucky. We were on the lottery system and won a place at Johns Hopkins after 2.5 months. After several suicide attempts, a very bad car accident in which she was very, very lucky. The last 2 points I have to make, and these come directly from her. She said, Mom, this was a few years ago, Mom, I'm taking medicine. My medicine is helping. I am the only person I know. She was living here at the time. I am the only person I know who has my illness who can afford my medicine. What are we going to do about that? We lived in Germany 11 years and in England for 1, and I won't spend time on that except to say that was not an issue there. She didn't have that issue there, but that was not an issue there. The last thing I have, maybe you can educate me on this with an instant answer. She said to me, Mom, I love life. I love my life. I love my life, but I want to live. I guess that was really the statement. I want to live. But there have been times when I have been in such a bad place, all I wanted was to die. And in that moment, no one would be able to convince me that I had any reason to live. Why can't they make it that a person like me cannot register for a gun? I don't know if that is correct, that she can, but she said she's usually right about things, I have to say. She said, I can register to get a gun, and if I get a gun and I have the wrong day, I may not be around tomorrow, and I don't ever want to be in that situation. So as a mother who loves her children very deeply, and for all those who have expressed what they have, please help. Please let us know how to help. And I would ask that there be parent support groups. I don't know that there are for people who have bipolar disorder. I searched at the time when she was diagnosed. I could not find anything. I read every book I could read, talked to everybody I could, and I thought, there are people that are maybe not as strong as I am. And even in my strength, I felt very weak. So I thank God and I thank you all for listening.
Hi, my name is Sophia Mayer. I'm from State College. And I definitely want to thank you for putting on this meeting, and I want to thank all the amazing speakers so far. There's not a lot I can add to that, so I won't even have the pretense of adding to that, but I do want to talk about next steps. In State College, there was, in the immediacy of the murder of Osaze Osagi, there was a lot of talk about a task force, and I want you to understand why we're skeptical about the idea of a task force. It's because we saw how the task force that was instituted beforehand was used. Task forces are very useful for exposing a problem. But we already know a problem exists We already have experts who have testified to you here today. The way it was used in State College previously was to say, hey, look, we're in the middle of doing something. Right? It was also used to occupy otherwise activists' time and to use them as a shield to say, look at the number of organizations that are with us. Let me count them. All those organizations were doing was saying, here's a problem, but they were used as a shield. So I'm not sure that we need a task force so much as we need to do something about the issues that are here before you. We don't need to expose the problem further. We already know there's a problem, and we already have a basic idea of some of the solutions that are necessary. And so all of you are excellent. I don't know any of you personally, but I also know, and forgive me for saying this, but y'all are very good nodders. But I need to know if you're actually listening. And the way to do that is outside of this room. I want to see action, and I want to see it very quickly for the sake of every single person who is vulnerable here today, for your sake. Thank you so much.
Just briefly on that, Sophie, thank you for that. That's very helpful in terms of the frustration that's out there by folks who are saying task force is not going to do anything. Oh, I'm so sorry. Yes, if you wanted to, you could absolutely come up to the microphone. I just wanted to comment quickly with Sophie's. We were not the county government wasn't part of that task force. So in terms of our entrance into engaging with these issues, we haven't been a part of that. But from a number of different initiatives we've taken, there's action at the end of the road. So I listen. I think we all do. So thank you for your comments. Thank you.
My name's Deanna Martin. I've had mental illness since I was 16 years old. I'm going to turn 58 next month. I've had a lot of challenges in my life. When I was 16 years old, I really felt depressed, and I started to hear voices, and then things weren't going well, and I ended up calling my primary care doctor, and they were good enough to send me to Geisinger mental health facility when I was 16 and 17. Then when I turned 17, I went to a partial hospitalization program in Bellefonte. It was called Council House. And I went there almost 3 years, and it saved my life. Just like I want to say that Clubhouse is a wonderful place. I've been there almost 6 years, and it has helped me so much. And I'm so thankful for the county commissioners for showing up to all these events we have too. Out of the Darkness Walk in the rain, Steve, and Out of the Darkness Walk, and Candlelight Vigil, which is wonderful. And we were so fortunate to have you there to present us with the certificate. And thank you for listening.
Hi, my name is Jean Morrow. I live in State College. I'm blown away by what I've heard tonight from everyone who has shared their vulnerability. I deeply appreciate it. When I first heard about what had happened to Asazi, my immediate reaction, and I was not the only one in the room to have this exact same reaction, was whatever happened in that room, if it had been me, I'd still be alive now. I think that is a really deep, a really difficult problem. I don't think it will be solved by a task force. I think it's kind of an underlying thing. I understand that the State College Police do a great deal of training. I don't think this can be trained into or out of anybody. So I'm actually going to just leave that alone right now, except to say I have no doubt that race was a huge, huge factor in the outcome. I am more, and this is a very short-term, immediate question, I guess, or response. I should say that when, like, in the mid-90s, I volunteered at the previous iteration, maybe 2 previous iterations of Can Help. If you're not aware of that organization, it was created by Penn State students back in the 70s. At the time, it was called On Drugs, and it was very specifically designed to give people who were using drugs a safe, free place to call to ask questions. Does this interact with this? I'm experiencing this. Should I be worried? My friend is reacting in this way. What should I do? And even in the 90s when I was there, we had recently changed our name to Wellspring, which was a much better name. But an awful lot of the training at that point was Merck manual. You'd sit and you'd look at the manual and you'd get a call. This is all pre-internet. So there was that kind of background. The people, for the most part, who were answering the phones, who went through the training, were volunteers. Well, they were all volunteers like me. Most of them were pretty transient in the community. They were largely Penn State students who were interested in mental health as a career and wanted some hands-on experience. For me, it was a mind-blowing and wonderful experience, and I think for the other people, because we learned so much in the training. But none of us were mental health professionals. My sense from talking to people who are in the current iteration is that that piece of it hasn't changed. They're all volunteers. They trade a really, I don't know what the training's like now, but I was always impressed by how well the training, how much it affected all of us and how well it made us work as a team. But I don't think it replaces the kind of training that a true professional has. And here's a really important part to me. I was there overnight many times. There was a whole system around what you did with, I guess, what would have been the equivalent at the time, or maybe it was even then, I don't remember the number, but if somebody was being involuntarily put, oh, sorry, 1 minute. So the deal is, I never remember anything except connecting when there was an issue. If I had a phone call, connecting to whoever was serving the mental health part for the night. And in that time, no police, police may have been involved, but the person who went in was a trained professional. And that was, I assume, the first person who showed up, the lead in the situation, whatever that situation was. And apparently that's not the case anymore. There may be all kinds of reasons why it can't be the case anymore. But it seems to me the very first thing that would have changed the outcome is what an awful lot of people have said. You don't want a police officer knocking on the door. It's just a really bad place to start, and I feel really strongly that that's the first place. Maybe it takes a task force, but that's the first place to make a change. Thank you.
Can I just comment on one part? I just want to clarify something. So you volunteered at Wellspring, correct? It became that. And then it became Community Help Center. And then it becomes Center Helps. Right. Center Helps is what's operated by the volunteers. They do a lot. They actually have been trained. Leanne literally was just in front of me like 5 minutes ago. They are trained National Suicide Prevention Hotline. Their volunteers are still the volunteers. Can Help is our trained professional mental health professionals. Okay. And it's very easy. It's okay. It's very easy to understand that. But Can Help is our mental health professionals that are trained, that go out, that take the phone calls as well, and do the mobile work, and as our delegates. Center Helps is where the volunteers really come into play. Link people to resources, link them to information. They refer individuals to us, but to different organizations.
Thank you for that.
Sure.
My question, I guess, still remains, which is, if typically Can Help is mental health lead in any kind of thing like this, where were they that night?
So, and even in my iteration and working with the counties, is that delegates have not always been with our law enforcement. They've not, and you said earlier you thought that they had been. You were probably talking to a delegate who was working through the process of petitioning, meeting with the individual, getting the warrant secure, but that warrant does not always require, or have an individual as a mental health professional with them. And so that hasn't changed necessarily over our time. It's just been brought up tonight as an idea for it. So I wanted to answer that. And I can tell people were like, wait a second, I thought, and so the two names are similar. I just wanted to separate them out for that. So thank you, sorry.
No. I also want to say thank you very much for listening when we came before you, each of the Tuesday meetings when we came and prepared statements and giving us the space to do that. I feel like it's very important to point out, while we are so grateful that you have opened this up and you're willing to listen to the community, that right now what I'm seeing happen with the media, because they've come to a couple events that we've had since you've called for this forum. Number one, they gave the credit completely to Bernie Cantorna and not at all to the community activists who have been coming and been speaking. I think that is very unfair. I think that they are kind of trying to shift the narrative. And they're putting the onus completely on mental health. While, yes, this is very important work, and clearly tonight so many wonderful points have been brought up, I think that it is very dangerous to not look at the intersectional nature of what happened. Of course the DA would want to take the focus off of the police officers. Of course. He exonerated them. We will never see justice per that report. We don't want this task force. We didn't ask for another task force. We asked for a community oversight and review board that would be able to oversee, that would be able to plug in and take what the community has as concerns and be able to turn that into actionable change and accountability, and that we would believe that there's actual transparency. I know that you all are dealing with funding for mental health, but I don't want to keep being fed this task force as a solution when it is exactly what they gave to us to dissuade from what we are asking for. And I don't want the mental health professional community to think that we are blaming you for this entire situation. And I want for people to understand that the people who are working in this community are working for change in all directions. We see this as a multifaceted intersectional issue, and we want change from law enforcement. We want change from mental health professionals to be enabled to do what needs to be done. We want justice. So yes, thank you again. And I guess that's all. I wasn't planning to talk, but thank you.
I just want to say yourself, Ms. Lang, I think Mr. Landers-Nolan, all visited our commissioners' meetings at separate times, and you had everything very well researched and pretty much on point, and always appreciate that when citizens show up to our meetings having done the research. Thank you.
Good evening, and my name is Leslie Lang. Thank you, Mark, and thank you, Mike, for acknowledging us and the work that we put through to even come together to partner to provide these services. I'm sorry, I know my voice is gone, so I didn't talk, but I'm saving us another 16 hours because I'm echoing everything that we've said, and Melanie came up and clarified what it is that we're asking for, and I am providing my 27 questions to add to your website for both you and Natalie to offer responses, and that will go a long way in the transparency and next steps that you need to provide. Thank you.
So hi, my name is Carolyn Hetrick. I live in State College Borough. I'm one of the pastors at Grace Lutheran Church, which is privileged to host things like Out of the Cold, which is a wonderful opportunity for us to interface with a lot of the community and folks who have significant needs. Before I became a pastor, I'm also a lawyer, and I used to do mental health commitment hearings where I represented the mental health consumer. And I will tell you that there are a lot of things I could say about that process. I could tell you about my family with mental health issues. I could tell you about the suicides that have happened in my family and among my friends. But what I really want to say to you is this. There are two things that I think I've heard tonight, and one of them is that there's a huge cultural piece. And a lot of my friends who don't look like me will tell me, don't ask me how to do my job better to understand you. Learn to school yourselves. If you're going to do a task force, in addition to that, provide extra folks who can help you have the lens to understand ethnicity and race and diversity on top of whatever else you're doing, so that you can school yourselves and have that be a mutually beneficial process. The other thing I want to say is this. You've already heard enough tonight to do something really important at all levels, at the county level, at the Commonwealth level. Advocate for us. You build budgets. I used to be on a borough council. I understand. You build budgets. Advocate for the needs of the folks that are here tonight and all of those that they represent. I understand that we're switching from the full hospitalization model to other recovery models. If we can't get that happening with private contractors, build a budget in the Commonwealth that has the wish list of what we really need. Because I can tell you that not a day goes by in my life as a pastor where I don't have someone coming to me with a mental health concern, and I have literally nowhere to send them. And what I end up doing is using the power of prayer, and I know God can do all things, but honestly, build what we need. Advocate for what that is. Don't give up. You have all of the relationships and the synergies with legislators. Work it. Work that network. Because people are dying out here. Some of those people have been people that I have loved deeply. And I think everyone here is telling you, it's time for you to advocate for us. Start there. You have enough tonight while we're asking all the other questions. There's a fiscal budget that's always being built, and we count on you. Thank you.
Did you want to say? Okay. My name is Jess. I'm from Spring Township. I'm here to advocate for my students. I have students that come to me that are 5, 6, 7 years old, and they don't have a voice to be here tonight. They come to my classroom unable to sit in a seat. They're unable to control their behaviors. They're unable to learn academically and behaviorally. It's my job to get them to do that, and I can't. When I can't do that in the classroom with the means that I have, I look outside to the county to help. You talked that, so there was partial programs. What are those partial programs that I could help with for my kids?
So, refer to the name correctly. It's
Did you say that, or?
Hearts
Would you rather
program,
not?
sorry. So it's the Hearts program. It's through Home Nursing Agency. It's through K through 5 age is what provides that service for us. It is a very specific partial hospitalization program that is available for kids.
Right, so that's one program for all of the students here, and there's only specific qualifications for those students. So if I have a student with an intellectual disability, they're unable to attend that program. They're unable to get benefits from that. What else is there? We send them to outpatient facilities that are available, but I never see them back. I don't get them back in my classroom. They don't come back. So I want to change that. It breaks my heart to see that I can't help them in the classroom and I'm unable to reach their means. I send them out somewhere else to hopefully get help. And in my mind, I know they're not going to get it. They never come back. So what can we do to get those kids, the 5, 6, 7-year-old kids, the help they need at a young age so we don't see them out here on the streets going into prisons? We're not providing for them. And we need to change that.
My name is Julie Hall. I am a mother of a amazing 10-year-old little boy on the spectrum. And I struggle to find him services. I don't understand why there's not more services for kids when they're younger. So he doesn't end up like these other kids. When the story broke, all I kept thinking is, that could have been him. I don't want that to be his story. I don't want to have to fight to find him services. And I just don't understand, like, why can we not help them when they're younger so he doesn't grow up to be like that? I just want to know, like, why can't there be more services for the younger kids?
So Natalie is the administrator of mental health, intellectual disabilities, early intervention, and drug and alcohol. Within our early intervention programs, which work with kids from birth to three, we've served more year over year. There's been an increase in those services, and we've actually been able to partner with the state to get more kiddos services and for the state to chip in money to assist them. So we have seen an increase in the need, and we have seen the ability to fund those programs as well. So that's one opportunity through that early intervention program for.
But is there more that we can do? Because what I see for my future is that as he's aggressive as a 10-year-old, he's cute now, but he's not going to be cute when he's 18 and he's aggressive. I don't want him to end up in prison. I don't want to end up hurt by him. And I don't want one day on the news to be like, well, where was his mother when he committed X, Y, and Z? Why didn't she fight for him? Why didn't she get him help? I'm trying desperately at the age of 10 to get him the things he needs. And I don't think it should be that fight. There should not be that fight for me to get him what he needs so he doesn't grow up like that. And I just want you guys to be able to do something, to make a change, so that this isn't his life. Because my son, who is adopted, he grew up, he was born to his mother, who was born drug addicted. And her mom was born drug addicted. And I don't, like, there's these cycles. I don't want that to be his story. I want to change his story. And I need help. I need help to change his story.
Thank you.
I'm just going to give you my card as you walk out. I don't want you to not walk away with that. Thank you. Oh, I just bumped that. I'm sorry.
So my name, can you hear me? Okay, how's that? So my name is Jeff Landers Nolan. I'm a resident of Pine Grove Mills, Ferguson Township. I'm a licensed professional counselor in the state of Pennsylvania. I used to work for CanHelp from 2012 to 2013. I've talked to the commissioners before. I'll try not to repeat what I said there for the sake of brevity. And I'm having trouble organizing my points because so many excellent things have been said already. There are a few that I think I want to amplify. And I'll try to limit myself to things that I think have not been brought up yet. I think the first thing that's striking me that, I don't know her name, but that the pastor here was saying in terms of advocacy and in terms of budgets, in terms of numbers, we can look specifically at lots of areas where there are gaps in the mental health system. And the most important thing to do is to listen to the pain of the people in this room who have experienced that viscerally. But those gaps, like so many others, have to deal with a lack of funding. The simple answer is more. More funding, more services, more support, more staff. I think what's so important about the budget piece is that budgets look bloodless, and they are not. Budgets contain the power to save or destroy lives. And hearing the pain that's been shared in this room tonight, those of you at this table, but also those of us in this room, are in a position to take what we are feeling and advocate. Now, those of us in this room have our circles, and we have our influence, and we have our power, and we will show up to meetings, we will speak, we will make our points. But the people at this table are the ones who have those connections, who have those relationships. And when Beck, who's the woman from Australia, spoke, The point she made is so critical. We find safety as human beings in relationships. It's how we keep people in treatment if they don't want to be in treatment. It's how we change minds when people don't want to listen to us. Please use your relationships to increase the services, increase the funding, increase the support. I want to touch on 3 more points, and I'll try to make sure I stay on topic. One thing I want to mention that I think is in Leslie's sheet of questions, but that I still really want an answer to. Numerically speaking, the number of 302s issued in 2016 was, I believe, something like 64. In 2017, it was, I think, 56. I might have those 2 things flipped. In 2018, it was 304. Now, that does not happen by accident. Something changed. And this year, as far as what the DA's report said when it came out, we were on pace to match or exceed 2018's numbers. I'm familiar with the 302 process. I cannot explain what happened. And I know that there's some investigation going on or queries going on about that. But I really want an answer on that because I think that is critical to not just what's happening in our mental health system, but what the DA is saying in terms of, our police are overburdened in terms of their contribution to the mental health system. I think that's something worth listening to in order to separate these things, and I'll touch on that again later. But I think that's really important to look at. One thing I would suggest as far as that goes, as far as I understand, I believe there was a change in leadership in Can't Help around December of 2017, and I know nothing about the person who was in charge then or now, so I don't want to say anything positive or negative about them. I do know the person who was in charge before then, up until 2017, Shannon Quick. I thought very highly of her. I thought she really knew what she was doing, and she was really great. And I wonder what the connection is between leadership possibly changing at that point and this incredible number of 302s occurring. The other 2 things I want to mention, race has been something that is so critical to keep in focus in our conversation here because it is intersectional. I want to focus our attention also on race as it applies to the mental health system. As far as I remember, I did not receive any training on cultural competency or really humility or trauma-informed practice when I worked for Can't Help. Eva and I were in the same grad school cohort, and I think either of us can tell you there are mental health professionals who are not culturally competent and who do not care to be. And that is a problem. I take that very personally as a member of that community. I think not just does that need to be mandatory for our police, it must be mandatory for our mental health professionals, myself included. The last point I want to make, jumping directly off of that, we've heard plenty of people and plenty of pain to tell us that the mental health component is critical, but only a piece of this issue, that the policing issue is enormous. And I want to leave us, in terms of my comments, with a simple truth. Basic suicide prevention, if we do very little else, if someone is feeling like they want to end their life, especially if they have a plan, and there is a firearm involved, there's a gun involved, the more steps we can put in between a person and a firearm, physically and figuratively, in terms of the number of decisions they need to make, suicide rates drop precipitously. Now, if we put in a mental health crisis a person who is always armed because they are a police officer, the odds of that person dying go up significantly. That is simple statistics. That is a practical fact. And I think it's something that must not be ignored when we look at the totality of this problem. Thank you.
Good evening, how you doing? Good. My name is Jordan Emily. I lived in Benner Township from 2014 until 2017, graduated from Bellefonte High School. I now live in the State College Borough, and I attend Penn State. I study education and public policy. I didn't really plan to talk about anything tonight, but there was just like a small movement that I had that I really did feel the need to go ahead and talk about something. And I don't really think it's something that's been covered necessarily, and I just want to preface this by saying I'm going to ask questions. I'd rather them come off rhetorical other than definitive. Make them as a comment and not necessarily as I would like an answer. I would just like for you to think about these things and pose them. So I'm very passionate about education and about being knowledgeable in the areas around certain topics of a main topic, right? So if we're talking about mental health, I would like to look at the different areas around mental health and how that like contributes to this larger issue, right? So obviously we saw a lot of numbers on the screen regarding funding from the state and the county about providing services. But I have a question about how much of that funding is going into research of these services being used. By who are they being used? Sorry, I lost my spot. By who are they being used? How accessible are they to the members of Center County? How long does it take to get in, and how long would it take for a certain group of people to get in? How effective are they? Those are just some of the questions that I have of the smaller topics regarding this larger issue of mental health, right? And as the gentleman previously said, we have a Research One institution right in our backyard, which is the largest employer of Center County. We have a large medical facility, which is the second largest employer of Center County. How are we not using those resources that we have to research what is going on in our mental health world? And more specifically, I just want to go off about this real quick because it's very passionate to me. What is going on with our young men and boys? What is happening with our young men and boys? We need so much more research done into why there is so much toxic masculinity and the fact that young men and boys don't feel that they can go and seek out these services that we provide, but these services that are exhausted in Center County specifically. I used counseling and psychological services at Penn State last semester. I had 6 free services for the semester as per my tuition dollars. I had 3 additional services for a total of $9, $15 each for the last 3. And I felt guilty because I know that my problem that I was having might not have been as substantive as the guy behind me who felt like he couldn't come to CAPS because he was a guy or he was going to look like that whenever he walked in there and he didn't want to feel weak. It's important for us to look at and find services and provide funding for everybody, but most importantly for young men and boys so that they are able to go and get the help that they need and find the services that they need that best fits them and best suits them. But again, thank you so much for having this open forum. It's really awesome to see democracy come out here and play its part tonight, especially within the community. So thank you for that.
Thank you. Any other comments? Anybody in the hallway? Last call for any public comments? Oh, please.
I'm going to hand these out to you as a copy of my presentation. Is there some links on there for some really good information?
No, I think she has more.
Oh, you get two?
Oh, you got 2. Okay.
Thank you.
That's okay, I can get it from, I can hold it. Thank you.
Okay, my name is Ellen Freeman. I am here to speak on behalf of people of color and those special people like my son who are on the autism spectrum or have other mental challenges from time to time. I was very devastated by the recent shooting of Asazi. From reading the police report, it is pretty obvious that de-escalation was non-existent in the handling of this whole thing. Having the police investigate themselves was also very disturbing. Why would that happen? The alibi on what happened seems to make no sense. Their actions and explanations do not convince me that this was a justifiable action. All the police accomplished was to intensify the stress in an already traumatized individual. I am here today to request that you please revise the 302 procedures and allow mental health professionals to handle mental health crises. Deadly force should not be a high priority. There are places in the world that already are doing this and having promising results. One example of this is in Eugene, Oregon. It is at the White Bird Clinic and called CAHOOTS, which stands for Crisis Assistance Helping Out on the Streets. They provide mobile crisis intervention 24/7. I will give you my written statement, which I just did, which includes links to relevant information about this program in Eugene, Oregon. I will also be giving you links to research that justifies why this is more effective than what we have in place right now. I hope you take action as soon as possible so we don't ever have to see another individual murdered. Thank you.
Okay, yes, please.
So my name is Sheehan Ma, and I live in Spring Township. And one thing that hasn't been brought up here, we talk about multi-training and say multicultural counseling and things, but I think all of us in this community, and especially those in the task force and you all, we need to look at our implicit biases. We need to have the courage to go on to implicitbias.org and take those tests and find out what we're unconscious of. You know, so that could be racially, that could be LGBT, because everything that we see and our attitudes, what we think is important, who we listen to, who we don't listen to, you know, how we perceive people is so set up in our biases, and when we're breathing, we're biased. And I don't believe, I've taken every single test on that site, and you know, I've got my biases. At least I know where I need to look. And I know that when I'm looking at things, are likely to be distorted. And I'm also wondering, in terms of our priorities around all this mental health things, I don't think there's a test on there for mental health, but what kind of biases do we who have privilege in this realm by not having diagnosed or life-changing, life-altering mental health issues, what kind of attitudes are we sitting with in this country with the stigma and the shame and things that tends to be associated with this, and what does that keep us from taking seriously, and what does that keep us from prioritizing? So I'm just asking, my prayer would actually be that everybody in this whole country would take the test and then we'd start to work inwardly as well as trying to do things outwardly. Thank you.
Any other comments? Yeah, please.
Hi, my name's Chris Morrow. I live just up the street. You know where I live. I saw you just a few days ago to help out landlord-wise with my neighbor, just a locked door situation. Just sitting thinking about some of the thoughts that have been expressed about police, and all I really wanted to try to put out there is that I think there has been this ratchet happening. It's like a parallel to the cultural attitude about the armed forces, about people who serve in the military, whereby it's this strange, unfair treatment, and I mean unfair to everybody, of putting somebody in a sort of box where they're more than just human, but something beyond that can be asked to do everything and at the same time not held with all the same responsibilities. What I guess I'm trying to express is that if you have a set of people that have to be enforcing the law and EMTs and mental health officials for us and everything else, that's not fair to the community. It's not fair to them. It's so much of a burden. But the reason it keeps happening is because if there's a cultural agreement that that's the kind of people that exist, then nobody can blame you for that being a first and last resort. We sent police, so how could it possibly be more than that? Police are everything. They're superheroes among us. And because we sent a superhero, you can't do better than that. And that's part of why it's so hard to then ratchet that back and ask, what if, for just this one segment of things, we tease that apart and we say there are mental health people who are experts at de-escalation and just leave it at that. And that plus the guns, you don't have to think about blame or personifying things when you just have the knowledge that the presence of the gun is such a multiplying factor to any kind of danger. Guns literally go off on their own sometimes. They just, it's not about, you know, I guess that's pretty much all I had to express there, is that we can, I think, gradually ratchet this back if we're willing to be more realistic and more fair to everybody and not put people on, I guess pedestal is the word, or even, it's not even other people, just the institution and the idea that there's this institution that we can put in this box so we don't have to worry about who's to blame anymore, because it's been settled, because the superhero was sent. So that's all.
Thank you. Anyone else for comment? Okay. Okay. All right. So we want to thank everybody for attending. We want to thank everybody for the comments, the thoughts. We have heard about from many people the system that we'd like to create, the system that we'd like to improve, and so the work is going to be continuing. And so we will be doing the processing and the answering of the questions, putting those out there, and then meeting again. And again, that time frame of July and August for when the State College Borough is also going to be coming up with their members and the creation of that task force. So we will be partnering with them as we go forward. But we want to thank you once again. I'll certainly give the opportunity for anybody else on the dais to make any comments or messages as well.
Make a quick comment. I do want to help, want to compliment all of our mental health professionals. It's a very difficult job, a lot of risk, a lot of unforeseen consequences, and I know pretty much everybody in that field cares and works very hard. All of us here in Center County have nuclear family, extended family, friends. I guarantee you at least several of them have some form of mental illness. And if somebody says that I don't have any friends or any family who have a mental health issue of any kind, is lying. This is something we need to work on. This is something we need to address. I've heard several great ideas tonight that maybe the county itself could implement in the near future. I've heard some broader concepts that are, as the county usually does, we're going to have to work with multiple stakeholders, maybe the feds, definitely the state, probably the local boroughs, townships, our outside providers. You know, some things we can maybe, to Commissioner Pike's point, implement within 6 months to a year. There's other things, though, it's going to take longer because there's a lot of moving parts. But thanks again, everyone, for showing up. Again, as I mentioned earlier, great information, a lot of lived experience, a lot of really powerful stories, and I'm having a little trouble falling asleep tonight.
Well, first I want to thank everybody for coming out. I think it's a very powerful subject, and as Mark indicated, there's very few people that have not been touched by a mental health issue in their family. I think that's a reality of the world we live in. We have maybe not a perfect system. I think we in Center County have a lot more services than a lot of areas, and we are blessed for that. We have, with Penn State University and some of the other not-for-profits here locally, and many of them are represented here tonight. I appreciate you all coming out. I think there are some big things that on the horizon to look at. I think one of the challenges particularly is the provision of services, and the thing though that I want to remind everybody about, and it's something that I think is really the most thought-provoking part of this, is it's easy to say, yeah, let's just put money into a problem. I think we need to look at the best place that those dollars could be spent, the best place, we have to look at the needs of a variety of different areas and figure out where those dollars are best distributed. It's going to be a challenge. It's going to be a challenge to find those dollars. It's going to be a challenge to figure out where those dollars are best spent. we have some pretty bright minds, both at the state and at the county level, and I hope we can all work together to find programs that benefit everybody, because as we've heard over and over and over again, there's so many issues out there, and whether it's HIPAA, whether it's personal choice, these are all things that we need to look at in a broad spectrum, and we need to look at them in the process of civil rights. I mean, the individuals that suffer from these afflictions have rights, and they have rights for self-determination, and we have to be careful we don't stomp on those in the process. So we need to look at this from a variety of different perspectives, try to figure out where those dollars are best spent. But there's a lot of thought-provoking issues tonight raised, and I think it's an opportunity for us to have some real good conversation. So, and find some solutions. So, thank you all for coming out tonight, and I really appreciate that very much.
Kelly, Scott, any?
Push this away while I go because I kept hitting it. Again, Nellie, thank you for asking Scott and I to come and participate in this. As we said all along through our presentation, we are a partner with the county is a partner with us. So it was great to hear everyone and all the different ideas. Again, some of this is federal, the HIPAA, they're federal laws. I could change it, I wish I could too, to a certain extent. You brought up the civil rights. But again, we're going to be a partner with the county. It's great to hear this. And thank you everyone that was here to share your story. But again, thank you, and we're here to help support the continuum of care.
Thank you.
Yeah, I would just echo that as well, and we're certainly looking forward to as the county identifies service needs, service enhancements, that we can work together and then certainly help get that done.
So I was just going to actually thank the partners that are in the room tonight. That as I look out into the audience, I saw a lot of community members. I saw faces that I don't know, which is great for us. We want those faces. But I looked in the audience tonight and saw a lot of faces that know us, that work with us, that engage with us in whatever way that is. And we appreciate you coming tonight too and listening to the same conversation, because you're part of it too, whether it's from the criminal justice world or from actually being a provider to us. I appreciate you guys taking your time tonight too to listen to this and to figure out how we all together can make that. And lastly, simply to the public and even for those at home, just the simple thought of thank you for using your voice tonight. We appreciate.
So with that, again, we are going to be compiling the questions, making this publicly available. And at a future date, we'll be holding another event, either the county or if the task force is formed by that time, we'll be joining them. But again, thank you very, very much. Again, the PowerPoints will be available online. And again, we thank you for your participation. So we will adjourn the meeting at this time. So thank you all again.
Thank you.